do here today, all that we accomplish is for the pursuit of truth for your greater glory. This we ask through Christ our Lord. Amen.
Thank you. At this point, do I hear a motion to dispense?
Mr. Chairman,
Yes,
I'd like to move
Honorable
to dispense
Delicio.
to the calling of the roll.
Second. There's a duly seconded motion to dispense with the calling of the roll. Hearing no objection, the same is approved. Any motion to dispense with the reading of the previous? Yes, Honorable
Mr. Chair, I'd like
Delicio.
to move to dispense to the reading of the previous minutes.
Second.
There's a duly seconded motion to dispense with the reading of the previous minutes and the adoption of the same. Hearing no objection, the same is approved. At this point, we'd like to acknowledge the presence of our committee members. We have Honorable Isidro Ungab of the 3rd District of the City of Davao. Honorable Deputy Majority Leader Ernesto Junicio Jr. of the 1st District of the City of Manila. We have Honorable Jesus Jess Marquez of the 1st District of Aklan. We have Honorable Dr. Edwin Cruzado of the 1st District of Cotabato. And Honorable Art Celeste of ano bang district? First District of Pangasinan. Comsec, to please acknowledge the our resource person this morning.
Good morning, Chair. Good morning, members. Here today in today's meeting, DOH, Dr. Between Reyes, Division Chief. From the PhilHealth, Dr. Lawrence Sabido. Dr. Charissa Claudine Castillo C. From DepEd, Director Leah Apaw. From the Philippine Information Agency, Mr. Demetrio C. Ragua Jr. From the Lung Center of the Philippines, Dr. Jubert P. Benedicto. From Jose R. Reyes Memorial Medical Center, we have Dr. Wenceslao Loderes. From the Southern Philippines Medical Center, we have Dr. Ricardo B. Audan, Attorney Oscar P. Mata, and Mr. Emmanuel R. Driz. From the Valenzuela Medical Center, we have Dr. Manuel B. Poxidio and Mr. Jeriel Robert P. Dating. We also have from Tondo Medical Center, Dr. Maria Isabelita M. Estrella. And from Talavera General Hospital, we have Dr. Maria Isabel S. Gallardo. And from UP NIH, we have Mr. Hilton Laon. Thank you so much, Mr. Chair.
Thank you. Today's meeting, we will be tackling three bills on the strengthening of the national program for the elimination of tuberculosis. We have 9 bills on mandatory immunization program and 4 bills on the national oral health program. And on the local bills, we have 10 local bills. So we have a lot to discuss this morning. I appeal to our resource persons this morning to please make your position brief and submit your position paper to this committee. So we now go straight to the first bill. But before we proceed, we'd like to acknowledge the presence of a committee member, Honorable John Tracy Kagas, of the Lone District of Davao del Sur, and Honorable Iris Montes of the party list 4K. We now proceed with House Bill number 1066, an act increasing the bed capacity of the Southern Philippines Medical Center in the city of Davao Province of Davao del Sur from 1,500 to 2,000 beds and appropriating funds therefore, by Honorable Isidro Ungab. Honorable Ungab is now recognized.
Thank you, Mr. Chairman, the honorable members of this committee, our guests. It is my honor to sponsor House Bill number 1066. This is an act increasing the bed capacity of the Southern Philippines Medical Center from the present capacity of 1,500 beds to 2,000. And may I request that the explanatory note of this bill be entered as my sponsorship this morning. And if the chair will allow, also with us is Congressman Kagas, who's author of 5573, that these two bills be taken simultaneously, Your Honor.
Yes, please proceed.
May I give way to the Honorable Kagas?
Good morning, Your Honor, my fellow members of the committee. This is the same subject matter, House Bill number 1066 and House Bill number 5573. In behalf of all the authors, most particularly the representatives of Davao region, our sponsorship speech will be, our explanatory note will be our sponsorship speech. So I so submit, Mr. Chair.
Thank you, Honorable Kagas, for the House Bill number 5573.
Thank you, Mr.
Yes,
Chairman.
Honorable Ungab.
And aside from this, the sponsorship of these two bills, there are also additional 3 congressmen from the Davao region who co-authored and pinapahabol pa po yung yung sponsorship nila.
Yes, for the record, aside from Honorable Kagas, we have Honorable Maria Carmen Zamora, Honorable Chino Miguel Almario, Honorable De Carlo Uy, Honorable Dayang Hirang Nelson, and Honorable Jose Manuel Lagdameo, and Honorable Leonel Jong Senisa for House Bill number 5573. So we now recognize the representative from the Department of Health, Dr. Between Reyes.
Good morning, Your Honor. The Department of Health expresses its support for House Bill numbers 1066 and 5573, which propose to increase the authorized bed capacity of Southern Philippines Medical Center from 1,500 to 2,000 beds. SPMC is currently level 3 with a 1,200 bed capacity, with a BOR or a bed occupancy rate of around 147% and an implementing bed capacity of 1,800 beds. So in view of the foregoing, the DOH supports the proposed increase in bed capacity, as this will contribute to closing the hospital bed gaps in the region, provided that availability of lot expansion is available. Likewise, on Section 4, kindly revise the designation from Chief of Hospital to Medical Center Chief. Further, it is also recommended that the hospital development plan reflect the bed capacity and service capability of the hospital. Thank you, Mr. Chair.
Thank you, Dr. Reyes. We now recognize the Chief of the Southern Philippines Medical Center, Dr. Ricardo Audan, for his brief remarks.
Anyway, thank you so much, Your Honor. I actually have a very short PowerPoint. If they cannot show it, it's okay with me. I will just read this one. Okay. To Honorable Dr. Siriaco Gato Jr., Chairperson of the House Committee on Health, the members of the Committee on Health of the House of the Representatives, ladies and gentlemen, good morning. Allow me to introduce myself. I am Dr. Ricardo B. Audan, Medical Center Chief of Southern Philippines Medical Center. Joining me today are our Chief of Administration, Attorney Oscar Mata, and our Head of Human Resources, Mr. Imandris. First, I would like to express my sincere gratitude for this opportunity to once again present SPMC's proposal to increase our bed capacity from 1,005 to 2,000, an initiative originally championed 2 years ago by the Honorable Isidro Ungab of the 3rd District of Davao City through House Bill number 1066. After 2-year hiatus, I am pleased to share that this important measure has been revived through the renewed support of our 7 proponent legislators through House Bill 5573, and these are Honorable Maria Carmen Zamora, Honorable Chino Almario, Honorable John Tracy Kagas, Honorable De Carlo Uy, Honorable Nelson Dayanghiran, Honorable Jose Manuel Lagdameo, and Honorable Leonel Jong Sinisa. Again, my deepest gratitude for your support and trust. Your steadfast commitment empowers SPMC to fulfill its mandate as Mindanao's premier DOH government tertiary hospital. For over 109 years, SPMC has stood as the apex and end referral hospital for Mindanao, situated in the heart of Davao City on a 12.2-hectare property. It played a critical role during the pandemic as the lone government hospital in the city to handle COVID-19 cases extensively. SPMC stands today not only as a hospital, but as a beacon of hope for Mindanao. With 17 specialty centers and 35 fellowship training programs, we have transformed ourselves into a home of excellence, where young doctors no longer need to leave for Manila to fulfill their dreams of specialization. Instead, they find those opportunities here in the heart of Mindanao, serving the very communities that raised them. Our services extend from the most basic consultations to the most complex and life-saving procedures. We perform open-heart surgeries that restore rhythm to fragile lives, kidney and corneal transplant that give second chances, deep brain surgeries that quiet suffering, and stereotactic and robotic procedures that represent the forefront of modern medicine. Many of these breakthroughs were first realized in Mindanao through SPMC, proof that world-class healthcare does not have to be a distant or inaccessible. Today, with almost all services already available at SPMC, our patients, especially those from across Mindanao, no longer need to travel to Manila to seek these advanced procedures. What was once a journey of distance, expense, and uncertainty can now be found here at home, here where families can remain close, here where hope is not miles away, here where healing happens within reach. But beyond the technology, beyond the statistics, and beyond the milestones, what truly defines SPMC is its purpose. Every corridor echoes with stories of survival. Every operating room carries the weight of hope, and every healthcare worker embodies compassion and action. As the only DOH government tertiary hospital in Davao City, SPMC remains the cornerstone of public health in the region, standing firm for the poorest of the poor, for the most vulnerable, and for every family who looks to us in their most uncertain moments. And with that spirit of service and commitment, I actually have a census for this, Your Honor. But in the interest of time, we'll just forego. With our data, we have identified critical challenges at SPMC, including persistent overcapacity, rising patient demand from across Mindanao, strain on our healthcare workforce, and the limitations of our current bed allocation, all further constrained by a limited budget that restricts facility expansion. Increasing our authorized bed capacity from 1,500 to 2,000 is a strategic, cost-conscious response to actual service demand, patient safety requirements, and our mandate as the apex referral hospital in Mindanao. This expansion will decongest wards, improve patient flow, optimize resource use, enhance quality of care, and better support our healthcare workers in delivering timely and compassionate services. With the continued support of legislators, the Department of Health, and the Department of Budget Management, SPMC will be better equipped to meet the growing healthcare needs of the people of Mindanao. Maraming salamat po.
Thank you very much, Dr. Audan. Yes, Honorable Cruzado.
I'd like to make manifestation for the support of this bill, a product of SPMC 40 years ago as a intern. Actually, if you look at SPMC, it is all services brought in one place. We have kidney, cardiac, cardiorespiratory, orthopedic, psychiatry, all services brought in one. Unlike here in Manila, orthopedic center is one hospital, cardiac heart center is one, but in SPMC, all of these brought in one place. Yung 2,000, baka kulangin pa yan later on. So I'd like to manifest my support on this bill. Thank you very much.
Thank you, Your Honor.
Thank you, Honorable Cruzado. Before we proceed, we'd like to acknowledge the presence of committee member, Honorable Agustina Dominic Tina Pancho of the 2nd District of Bulacan, and Honorable Alfel Bascog of the 1st District of Agusan del Sur, and Deputy Speaker Dr. Virginal Biron of the 4th District of Iloilo. Any motion from the members?
Mr. Chair, I move to approve House Bill number 1066, an act increasing the bed capacity of the Southern Philippines Medical Center in the city of Davao, province of Davao del Sur, from 1,500 to 2,000 beds and appropriating funds therefore. So moved, Mr.
I
Chair.
second, Mr. Chair.
And also House Bill 5573, Mr. Chair. To consolidate the two bills, I so move, Mr. Chair.
Second, Mr. Chair.
So there's a duly seconded motion that for the approval of to consolidate House Bill number 1066 and House Bill number 5573 and approve the committee report subject to style and amendment. Do I hear any objection? Hearing none, the same is approved.
Thank you, Mr.
Congratulations.
Chairman. And may I also
Co-author?
manifest the inclusion of the members of committee members and committee members and House members present here as co-authors of this bill.
I second, Mr. Chair.
There's a duly seconded motion that all those, with the permission of the authors, all those who are present here in this meeting this morning, be made co-authors of the substitute bill. Hearing no objection, the same is approved.
Mr. Chair,
Yes, Honorable Biron.
yes, I would like to have a little clarification now that SPMC Medical Center Chief Dr. Audan is here with us. I understand that there is an acute need to increase the bed capacity of SPMC. May I know, Doc, what is the actual occupancy at this time?
We are supposed to be 1,500, but the actual occupancy is 1,800. That's 140% increase.
No, because, well, I'm sorry, Mr. Chair, that I came late. Because I was thinking earlier, coming here, that instead of increasing it by 2,000, because 2 years, 3 years from now, you'll be coming back to Congress and have it and apply for another increase in bed capacity. Why not make it 2,005 or even 3,000?
Nice.
So that it's a one-time amendment, one-time legislation, and then the capital outlay and all the budget inherent to the actual bed capacity to be approved will be done on a graduated manner instead of coming back to Congress every 5 years. And we all know that, you know, all medical centers under DOH or even in district hospitals, they always exceed the bed capacity as provided in the license to operate. So gano'n naman ang situation, eh. Wala namang DOH hospital na hindi nag-exceed ng bed capacity. So at this point, the actual occupancy rate is 140% of your allowed 1,005. So there's only a buffer of 200, which easily can be, can be filled up once this legislation passes. So why not make it 3,000 in anticipation of the growing
Yes,
need of the Davao Peninsula? Kesa bawat Congress o sa 21st Congress, babalik ka naman dito.
Tama yun, Your Honor. In fact, we are anticipating 3 infrastructure facilities that will open very soon, and we are really anticipating of more beds and the 140% actually is not enough. That's true, tama, no? 200 na lang para maging 2,000. In fact, our OPD, daily census of OPD, daily patients seen at the OPD is already 2,300.
Your
For the-
OPD census
yes.
is already 2,300.
300 for-
And how many of those OPD patients get admitted every day?
Yes,
Kasi pag
ma'am.
OPD, diretso na sa, yung iba doon, diretso na sa ER nyo. So, so why not make it 3,000? With our principal author here, Manong Sid, to make that motion, because hindi naman pwedeng taga Iloilo ang gagawa ng motion. It should be the Davao heroes, should be
Mr.
making that
Chairman?
motion. Thank
Maybe
you,
we can,
Mr. Chair.
we can now listen, hear the,
Mr. Chairman,
the opinion of Honorable Ungab and Honorable Kagas.
Mr. Chairman, I adhere to the wisdom of Congressman Dr. Biron, who used to be our chairman of the Committee on Health. 14th Congress ba yun? 14th or 15th? we were together in 2007. Thank you, Mr. Chairman, and in as much as we already approved this subject to style, as author of House Bill 1106, and I'm sure my co-authors here will agree with me that we are open to amending this. And if nobody would object, I agree, I adhere to the amendment to increase the bed capacity instead of 2,500 bed capacity, and include the Honorable Biron as one of the main co-authors of this bill, Your Honor.
Honorable Kagas?
Thank you, Your Honor. In the same vein, Your Honor, we are elated by the manifestation of Congressman Biron from Iloilo, and we are amenable to the increasing the bed capacity to 3,000 beds. About
2005.
2005. In behalf of all the sponsors, Your Honor, and
Thank you, Honorable Kagas. So it is now understood that the consolidated bill will now be will now be 2,500 instead of 2,000 bed capacity.
Mr. Chair,
Yes,
I think
Honorable.
before we really decide on the actual number of beds, I think we will give the medical center chief an opportunity to educate us on what are the plans of SPMC. Because right now, I understand you have your specialized centers like your Cancer Institute, your Heart Center, your Kidney, because the need to provide them with the X number of beds would really be dependent on the 5-year, 10-year development plan of the hospital itself. Because we as legislators, we only pass. We don't know exactly what is happening on the ground. So if we can give the opportunity to Dr. Aldan to educate us, what are your short-term plans and what are your, because past your retirement, I'm sure SPMC will be growing so fast. So the number of beds would really be dependent on the plans of the hospital.
Thank you, Your
Thank you,
Honor.
Honorable Biron. Actually, Dr. Audan had a presentation before you came, but maybe you can reiterate in a few sentences, in a brief sentences.
Yes, anyway, thank you, Your Honor. As what I have said, we have actually 4 facilities to open very soon. In fact, these are the Children's Institute, the Children's Institute, the Acute Trauma, the Infectious Institute, and the primary healthcare institute. And for this four infrastructure, for the short term, we already gradually opening the Children's Institute. Then very soon we'll have the trauma and the infectious. All of these consists of, I think, 580 beds for that if you combine it. Yeah. 580 beds.
Mr. Chair, they're anticipating the opening of the new specialized centers. They're anticipating, 580. So now we have 1.5. So that's plus 580. That's already 2,000. So easily, you can. And of course, I would like to ask also Dr. Audan, will your land area be sufficient for future expansion?
I have to be honest with you, Your Honor. Wala na kami ma-expand, but the SPMC has 12.2 hectares. Everything has already been used. So, yun po, 12.2 hectares. Pero lahat yung mga infra na sabi ko, nandun na sa 12.2 hectares.
Yes, because in the future, 5 years, 10 years down the road, you might probably consider satellite centers of the of SPMC.
Yes.
So that you don't have to secure separate license to operate, but satellite centers in the neighboring areas, contiguous to the main center would probably be considered.
Actually po, Your Honor, meron kaming area, parang 2 hectares given by the government in Bagushero. Bagushero po.
Yes.
Nandun po. So that's the future satellite hospital of SPMC.
And I think yes.
The 2 hectares was given by the local government in coordination with the, of course, national government. It is just beside the UP Mindanao, Your Honor.
Oh, okay. Yes, and I think, Doc Audan, perhaps you would consider it in your extension or your satellite centers to really build high-rise facilities already because of the growing demand for, and SPMC being the hub of the medical facility in the Davao and Cotabato regions.
Your Honor, we cannot go as far as more than 5 floors in the existing SPMC lot because the CAAP will not allow us because yung airplane doon dumadaan. Kaya,
It's a flight route.
yes po.
Okay.
Hanggang 5 floors lang kami. Kaya meron sana kami 7th floor pero hindi kami pinayagan ng CAAP.
Yeah, because, just to share briefly, Mr. Chair, I had a chance to go to Ankara in Turkey to visit because I also build hospitals. I have my own set of medical centers in Western Visayas. I built 3 international medical centers in Iloilo, in Aklan, and the latest one, the most beautiful hospital I built is in Bacolod. These are of international standards, JCI standards. And I went to Ankara for benchmarking. And they have 5,000 beds, probably in a 10-hectare, but these are all high-rise. Orthopedic center, heart center, cancer institute, so it's built by the government because in Turkey it's heavily socialized. The only thing you need when you go to the hospital for free admission and the entire healthcare is free is just a national ID. Government takes care of you. So that's the reason why I said that, with the limited land that you have, perhaps 10 years, 5 years, 10 years down the road, you need another area for satellite operations. That's all, Mr. Chair. Thank you so much.
Thank you, Honorable Biron. May we recognize Dr. Between Reyes from the Department of Health before we proceed to the next bill.
Thank you, Mr. Chair. So I would like to indulge the group with in Section 1 of both House bills, we already also indicated any future increase in bed capacity shall be consistent with the Hospital Development Plan that shall be prepared by the Department of Health. So this will also allow the hospital, SPMC, to have further expansion as necessary and appropriate to their growth. The second component that I'd like to raise is we also have House Bill numbers 1398, 1528, 3510, 3596, and 3776. all proposing to authorize the Department of Health to set and approve the bed capacity and service capability of DOH hospitals. So this is limited purely to the hospitals that are already under the direct supervision and control of the Department of Health, and this will allow us to also expand our facilities as necessary without needing legislation. Of course, there are some very specific provisions there that we will have to report to Congress, etc. But we would like to offer this to the committee members who are present here today to support the bill, as this has also been lodged in the Senate as well. So thank you, Mr. Chair.
Thank you, Dr. Reyes. Yes, now we proceed to the bills on the upgrading of hospital beds of Jose Reyes. We now recognize Honorable Ernesto Junicio for House Bill number 1097, an act increasing the bed capacity of Jose Reyes Memorial Medical Center in the City of Manila from 450 to 1,000 beds and appropriating funds therefore. Honorable Junicio is now recognized.
Thank you very much, Mr. Chair. I'd like to commend the Chair first and foremost for starting early and on time. Thank you po, Mr. Chair, for the honor and privilege. And again, it's an honor and a privilege to introduce, spearhead, and to sponsor House Bill number 1097. Mga kasama, ang Jose Reyes po ay isa sa mga ospital na nasa gitna ng metropolitan kung saan marami po ang populasyon at napapaligiran ng maraming mamamayan na mahihirap. Just to give quick information, Mr. Chair, Jose Reyes Memorial Medical Center located in the City of Manila has current authorized bed capacity of 450 as established upon Republic Act 4264. Part of its mission is to serve the population of the northern part of Metro Manila, particularly the areas of Caloocan, Malabon, Navotas, Valenzuela, and the City of Manila. According to the 2020 Census of Population and Housing of the Philippine Statistics Authority and the said cities together with the City of Manila, it is found that there is a total population of 4,800,000+ individuals. Clearly, Jose Reyes surrounded by some of the mostly densely populated cities in the metro. With the objective of being able to accommodate the less fortunate sectors of the society who have been deprived of quality medical service, the increase in bed capacity from 450 to 1,000 beds will ensure compliance from health facility calls and ultimately prevent patients in the City of Manila from being accommodated in hallways, waiting areas, and other spaces which are not intended for patient safety and health care. In fact, Jose Reyes Hospital statistics indicate in 2024 of 120% capacity. Actually, Mr. Chair, kausap ko lang po ang head ng Jose Reyes kanina, si Dr. West, nasa 130 to 140 bed capacity na po ang ginagamit nila ngayon. With the foregoing in mind, the bill seeks to increase the bed capacity of Jose Reyes from 450 to 1,000 beds. Necessary expansion to alleviate the plight of those in part of the most vulnerable sectors of Philippine society. Again, Mr. Chair, buong kababaang loob po akong nakikisuyo sa aking mga kasama sa Committee on Health na sana po masuportahan ang panukala ng inyong lingkod na mapataas po ang bed capacity ng ating Jose Reyes Memorial Medical Center. Maraming salamat po sa pagkakataon.
Thank you, Honorable Junicio. Before we proceed, we'd like to acknowledge the presence of our committee member, Honorable Juan Monique Bautista of Party List Trabajo, Honorable Agata Paula Aguilar Cruz of the 5th District of Bulacan, our Vice Chair, Honorable Walfredo Arman Dimagila of the Lone District of Binyan City, Honorable Kenneth Gatchalian of the 1st District of Valenzuela City, and Honorable Dr. Caroline Agyao of the Lone District of Kalinga. Yes, Honorable Pancho.
Mr. Chair, this is just a manifestation of full support to House Bills 1097, 5654, and 7973 to increase the bed capacity. This is a very significant assistance not only to our indigent patients in Metro Manila, but also in Bulacan. Kasi isa po kami sa nagpapadala po ng mga pasyente sa Jose Reyes Memorial Medical Center. At napakalaking tulong po ito in our district, 2nd District po of Bulacan. That's all, Mr. Chair.
Thank you, Honorable Pancho. For House Bill, this is also bills on upgrading of Jose Reyes Memorial Medical Center. For House Bill number 5654, authored by Honorable Milagros Aquino Magsaysay, and House Bill number 7973 by Honorable Attorney Mike Tan. Honorable Iris Montes will sponsor in their behalf.
Thank you,
Honorable
Mr.
Iris
Chair.
is now recognized.
Thank you. May I move that the explanatory note of House Bill 5654 and House Bill 7973 be considered as the sponsorship speech. I so move, Mr. Chair.
Okay, thank you, Honorable Montes. We now recognize Dr. Lauderes of the Jose Reyes Memorial Medical Center.
Good morning, Mr. Chair and honorable members of this committee. Magandang umaga po sa inyo pong lahat. I am Dr. Wenceslao Lauderes, the Medical Center Chief of Jose Reyes Medical Center. And with me are my execom, the CMPS, the Chief of Chief Nurse, the COW for Admin, the COW for Finance. So may I have a very quick manifestation, Mr. Chair. For the past 3 years, Jose Reyes Medical Center has been operating at 130 to 140% over its authorized bed capacity. This chronic overcapacity has placed significant strains on our facilities, healthcare workers, and most importantly, ang ating pong mga pasyente. By increasing our bed capacity from 450 to 1,000 beds, we'll be able to better serve not only our regular medical cases, but also fulfill our mandate as National Specialty Center. National Specialty Center for elderly patients, for stroke and and patients that needs brain operation, skin diseases, and even trauma. And as an advanced specialty center for cancer and those patients that needs cataract operations. The expansion will allow us to significantly improve access to quality healthcare services. Through this increase, mas marami pa po tayong matutulungan na pasyente, mas maiwasan ang congestion both sa ER at sa ward, at mas mabibigyan natin ng maayos, ligtas, at napapanahong serbisyong medikal sa ating pong mga kababayan. Magandang umaga po, Mr. Chair.
Thank you. We now recognize the presence of one of the authors, Honorable Milagros Aquino Magsaysay. Your bill has been sponsored by Honorable Montes, but if you want to have a brief manifestation, Honorable Magsaysay.
This bill seeks to increase the bed capacity of Jose Reyes Memorial Medical Center, JRMMC, the mother facility which supports the National Center for Geriatric Health. As a Department of Health, DOH, run Apex Hospital, catering to predominantly indigent patients. It provides a wide range of medical services to numerous clients. It is also a referral center for patients from far-flung provinces, and the increased influx causes longer waiting hours. JRRMC boasts of an annual average census of 13.542 inpatients and 232.780 outpatient over the past 3 years. With its recent designation as a specialty center for brain and spine care, dermatology, trauma, burn, orthopedic, neonatal, cancer and geriatric care, ENT, NHS, and eye center, a certain surge in patient volume can already be anticipated. With an authorized bed capacity of 450, JRRMMC consistently exceeds this limit, often reaching 575 actual bed census. There is a clear mismatch between the limited bed capacity of 392 public service beds and 58 private paying beds that has resulted in overcapacity and lengthy waiting list. JRRMC's strained resources is compounded by insufficient manpower, which comprise delivery of high-quality healthcare. While the NCGH was provided a separate and independent budget, it has, however, proven insufficient to meet the increasing and complex demands of its elderly patients, forcing the hospital to remain dependent on JRRMMC for over a decade and further burdening its already strained resources. Foremost among Filipino senior citizens' concerns is their health status and well-being characterized by degenerative and chronic diseases due to aging, as well as some physical impairments and disabilities. As such, the Philippine healthcare system must provide for their needs through comprehensive and strategic interventions, including highly specialized facilities with properly trained and skilled medical professionals. Increasing JRRMC's bed capacity from 450 to 1,000 will enable it to accommodate more patients with special needs. Increasing its capacity then will help JRRMC have more resources to improve its systems and provide better services as it continues to modernize through ample training programs and research. In view of this foregoing, the passage of this bill is earnestly recommended.
Thank you very much, Honorable Magsaysay.
Thank you, Mr. Chair.
Before we proceed, we'd like to acknowledge the presence of a committee member, Honorable Salvador Prieto of the 6th District of Bulacan, Honorable Maria Isabel Sagarbaria of the 2nd District of Negros Oriental, and Honorable Lionel Ceniza of the 2nd District of Davao de Oro. Dr. Between Reyes of the DOH is now recognized.
Thank you, Mr. Chair. The Department of Health supports the intent of House Bill numbers 1097, 5654, and 7973, which seek to increase the authorized bed capacity of Jose R. Reyes Memorial Medical Center.
Can you speak louder, Dr. Reyes?
The DOH supports the intent of the House Bills 1097, 5654, and 7973, which seek to increase the authorized bed capacity of Jose R. Reyes Memorial Medical Center and provide appropriate resources for its continued operation, strengthen its capacity to deliver specialized healthcare services, including geriatric care. As mentioned, JR is currently a national specialty center of 4, has 2 advanced care specialty centers and 4 basic comprehensive specialty centers, and is also recognized as an apex hospital. Given all of these, the department acknowledges the provision under House Bill 5654 recognizing the National Center for Geriatric Health as the Department of Geriatric Medicine of JRRMMC. This provision is consistent with the DOH Specialty Center framework and appropriately clarifies that NCGH shall remain integrated within the JRRMMC's organizational structure. Likewise, while the measure emphasizes strengthening geriatric services, the department respectfully recommends clarifying that the increase in bed capacity shall support the overall hospital service delivery, as mentioned, since they do have a number of specialty centers under them. I think that is all, Mr. Chair. Thank you.
Thank you, Dr. Reyes. Any member?
Mr. Chair, yes, Mr. Chair, I move to approve House Bills number 1097, 5654, 7973, and for the consolidation of these bills and for the approval of the said measures. I so move, Mr. Chair.
There's a duly seconded motion that House Bills number 1097, 5654, and 7973 be approved, subject to style and amendment. Hearing no objection, the same is approved.
Thank you.
Congratulations.
Thank you, Mr. Chair.
Mr. Chair. Mr. Chair.
Yes, Honorable
Yes,
Bureau.
may I know if the medical center chief of Jose Reyes is with us today?
Yes, Dr.
Kong, pare ko di, Kong.
Yes, Doc, may kababayan. Yes. Good morning. A few questions lang.
Yes,
With
yes,
this
sir.
increase in bed capacity of Jose Reyes, where do you plan to build, these new buildings?
Yes, Your Honor, we already have a concept plan that will be, this is more on the vertical expansion, sir. So vertical expansion, we have a proposed plan for our outpatient, and this will be a 10-story accommodating the proposed plan of making this a 1,000 bed capacity, because as far as horizontal expansion is concerned, medyo not feasible in our setup, sir.
As we all know, Doc, the challenge in operating a big hospital is not only the physical facilities, because certainly budget can be provided by government. But as I observe, and based on my own personal experience, the challenge in all government hospitals, DOH and LGUs, is that there is no comprehensive working hospital information management system. As I shared with you earlier, part of my benchmarking when I went abroad, Singapore, Turkey, Hong Kong, Shenzhen, and what makes the whole operation very efficient and avoid pilferage, theft inside the hospital, especially in government hospital, walang working and effective hospital information management system. And imagine you increasing the capacity from 500 for 450 to 1,000 is actually a nightmare. So may I ask, what is the hospital information management system that you have presently at JR?
Thank you so much for that question, Your Honor. Actually, this is just a very early concept plan that last year, once after we planned for the finalization of the proposed plan of making the 1,000 bed, we already identified committee, and we have some concept plans for this, Your Honor, but still very early, still very premature, but we duly noted that proposal, because yan po ang greatest challenge of making efficient service for our hospital. For now, as far in terms of percentage, maybe 10% on the concept planning, but not yet on the structured way of dealing with this, because we need to still itemize the need for us to move forward.
So right now, Doc, ang mano-mano lahat.
Yes, Your Honor. So we have some, sorry to interrupt, Your Honor, but we have some electronic way of dealing with this, but still not that enough to be able to use that as a anchoring point to use as basis in totality for move forward.
Yes, I think this early, Doc, as part of your forward planning, you should already consider putting the hospital information management system in place, because all you need to do is just expand when the physical facility is there. Because without a functioning hospital information management system, you are prone to theft, pilferage, and a lot of losses. Kasi you cannot account. Sa OR lang, hindi mo na ma-account yun eh. Pharmacy, grabing nakawan dyan. So, without an HIMS, the backbone of your operation will be a failure. So, at this time, and that is true for all other hospitals. Kasi, kahit sa mga malalaking hospital dito, sa Manila, personal experience ko, from the time the may go home order is made by the doctor, it will take you at least 4 hours para ma-discharge ka. In the meantime, the patient is consuming air condition, lights and everything of the hospital. Pero ang tagal-tagal ng release sa'yo. Sa isang malaking hospital dito, I don't want to mention the name, just for me to avail of my 10,000 PhilHealth, it took them 4 hours. So I told the hospital I would have gone out and just get reimbursed with my 10,000 rather than staying here in your hospital for 4 hours. So ganun ang challenge ng lahat ng government hospital because I don't have a working HIMS. So dapat i-consider talaga ito. Because providing a budget for equipment is not a problem, but looking for the right HIMS, is of utmost priority kasi you'll be losing more money. Yeah, thank you, Mr. Chair.
Thank you so much, Your Honor.
Mr. Chair, yes, I think Dr. Reyes from the DOH, it should be mandated by the DOH itself. Kasi kung walang command yan from the central government, walang mangyari. Kanya-kanya yan. Pero kung kayo mismo ang gagawa ng mandato from the central office, mandating that all DOH hospitals should have a functioning, I'm sure you'll be saving hundreds of millions, from pilferage, from theft, and from, because the most important there is the accounting module of the hospital.
Yeah.
At saka yung PhilHealth reimbursement, masosolve yan. Kasi automatic siya, i-online mo na whatever is, pagkatapos ng discharge ng pasyente, automatically, you just have to transmit what has been consolidated by the HIMS. So, masosolve yung problema ng PhilHealth. And that's what I did for my hospital. Thank you, Mr. Chair.
Yes, Your Honor, catch up lang po, sir.
Thank you, Honorable Biron.
Yes. Sir,
Dr. Lauderes?
yes, sir. Just to add up lang, sir, Your Honor, Honorable Chair from Iloilo, sir. Not yet on the hospital-wide spread, but the supply chain and the iHomies we already have in place, sir. But on the hospital-wide scale, not yet fully. Thank you so much, sir. We'll duly noted for the...
Kasi ang ideal talaga, Doc, Mr. Chair, ang ideal talaga, integrated siya. From your lab, pathology, integrated, including your LIS, lahat yun integrated talaga. And to have a functional hospital information management system, at least you need 80 modules. Because the operation involves internal customers from within the hospital. Yung bawat center mo, yung revenue centers are all your internal customers.
Thank you, sir.
Thank you, Mr. Chair.
Thank you, Honorable Biron and Dr. Lauderes.
Yes, sir. Thank you.
Honorable Plato?
Mr. Chair, good morning, everyone. I move that all our distinguished colleagues present be co-author of this bill, Mr. Chair. Thank you.
There's a duly seconded motion by Honorable Plato that all those who are present here this morning be made co-authors of the House Bill on the upgrading of Jose Reyes Memorial Medical Center. Hearing no objection, the same is approved. Before we proceed, we'd like to acknowledge the presence of Honorable Audrey K. Zubiri of the 3rd District of Bukidnon. We now move to House Bill number 5875, an act establishing a general hospital in the city of Alaminos, Province of Pangasinan to be known as the Alaminos City Regional and Tourism Hospital, and appropriating funds therefore by Honorable Arthur Celeste. Honorable Celeste is now recognized.
Thank you. Thank you, Mr. Chairman, distinguished colleagues and guests. Magandang umaga po sa ating lahat. Today, I'm honored to introduce this bill to this body, and just a brief information, Mr. Chairman. House Bill number 5875, an act establishing a general hospital in the city of Alaminos, province of Pangasinan, to be known as Alaminos City Regional and Tourism Hospital. Just want to inform this body that this is a refiled bill. This has been approved during the 19th Congress, but it was not tackled in the Senate because nataon na it's already a campaign period. So now I am again refiling this bill for consideration of the body. But for some information by our colleagues, our province is one of the biggest province in the entire country, and approximately around 3.2 million population with 44 towns and 4 cities. So in the province of Pangasinan, there are actually only 2 regional hospitals. One in Rosales in the 6th district, which is 4 hours away from my district. And number 2 is in Dagupan City, which is more than 2 hours away in my district. So when I talk with our colleagues in DOH, I ask this consideration for them, and okay naman po sa kanila because since my district is a tourist destination, being the host of the Android Islands and a coastal district, so they want to introduce this hospital as, consider this also as a tourism hospital. So besides the fact na malayo kami sa regional hospital, and in our district there is only one government hospital, which is the provincial hospital. Alam naman po natin ang sitwasyon ng provincial hospitals. So now I'm seeking the support of our colleagues that to support this bill, and our district mates are asking all of you to support this bill, an act establishing a general hospital in the city of Alaminos, province of Pangasinan, to be known as the Alaminos City Regional Tourism Hospital. And one more important information to our officials in the DOH, when this project was visited by Undersecretary Birheri, it was endorsed by her, at because of that, nagmadali po ang city government of Alaminos. Actually, the site of this hospital, which is almost 2 hectares, dinonate na po ito sa Department of Health. So meaning, ang kulang na lang talaga is yung batas. So sana po matulungan nyo kami sa 1st District ng Pangasinan para lang po matayo ang pangangailangan namin doon to improve health services in the 1st District of Pangasinan. Maraming salamat po, Mr. Chairman.
Thank you, Honorable Celeste. Dr. Bituin Reyes.
Thank you, Mr. Chair. The DOH acknowledges the intent of House Bill number 5875, which seeks to establish a general hospital to be known as Alaminos City Regional and Tourism Hospital in Alaminos. As mentioned, Pangasinan has an estimated population ratio of bed to population ratio of 1:1,239, and our target is 1 bed is to 1,000 ratio. There are currently 44 licensed hospitals in Pangasinan, 28 are privately owned, 14 are under the LGU, and 2 are under the Department of Health, one of which is the Region 1 Medical Center, which is a Level 3 DOH hospital, also already providing specialty centers for mental health and dermatology care, and is designated for renal care and transplant, burn, geriatric care, and cancer care. In consideration of the foregoing, the DOH interposes no objection in the establishment. However, it shall remain under the direct supervision and control of the province. The establishment of the hospital will aid in closing the gap for hospital beds in the province, maintaining the ownership and control of the hospital under the province shall ensure that the HCPN is able to deliver continuous health care from primary to tertiary care. The DOH, through the Ilocos Center for Health Development, may still provide technical assistance and monitor its compliance to standards in accordance with the Philippine Health Facility Development Plan and the Local Investment Plan for Health. That is all, Mr. Chair. Thank you.
Thank you, Dr. Reyes. Honorable Marquez.
Mr. Chair, I move to approve House Bill number 5875, an act establishing a general hospital in the city of Alaminos, province of Pangasinan, to be known as the Alaminos City Regional and Tourism Hospital, and appropriating funds. Therefore, I so move, Mr. Chair.
I second, Mr. Chair.
There's a duly seconded motion by Honorable Marquez that House Bill number 5875 be approved, subject to style and amendment. Any objection? Hearing none, the same is approved. Congratulations.
Mr. Chair, I also move that...
Yes, Honorable Prieto.
I move that all members present be adopted as members, as co-authors of this bills, Mr. Chair. Thank you.
There's a motion by Honorable Prieto, duly seconded.
Mr. Chairman, with the permission of our colleagues also in Pangasinan, may I ask the committee to include all congressmen in the province of Pangasinan as co-authors, Mr. Chairman.
Okay, so there's a duly seconded motion by Honorable Prieto to include, with the permission of the author, to include all those members present here to be co-authors, and also to include the, as manifested by the principal author, that all the congressmen of Pangasinan be made also co-authors.
Mr. Chair.
Hearing no objection, the same is approved.
Mr. Chair.
Yes.
Yes, one short clarification. Is it correct what I heard, Dr. Reyes, that the hospital envisioned to be created in Alaminos, sponsored by Honorable Celeste, will remain as part of the provincial government?
Yes, Mr. Chair.
So, is it the intention of the DOH to have this? Because I have a similar bill, actually, which has yet to be heard in this, converting our district hospital into a national hospital. But DOH objected to it without realizing the real need of having a medical center in a component city, because that's the hub of northern Iloilo. So when the right time comes, Mr. Chair, I will have to discuss this with DOH, because they have to understand the real need of patients on the ground. Kasi ang alam ko, ang default stand ng DOH, basta district hospital, ayaw ninyo i-nationalize. Because that's a default policy. In the last Congress, natapos lang ang 90th Congress, hindi ginalaw ng DOH yun eh. So this time, I will fight for the nationalization of that particular district hospital. So I wonder, because Manong Art, pag district hospital yan, walang mangyari dito sa ano mo. Maniwala ka sa akin, walang mangyari dito sa hospital mo.
DS, this is not a district hospital. It's a new...
it's a creation, but it will be under the budgetary provision of the province. Kasi iba naman ang budgetary provision ng national government. If you really want to have a very successful general and a tourism hospital, it has to be a national hospital. Under DOH talaga siya.
Yes, because, I agree, DS. Kasi po, yung Conrado Estrella Hospital and the Region 1 Hospital is under DOH. So, we'd be asking the same status of the funding, Doctor.
Yeah, but Manong Art, sabi niya kanina, ayaw nila eh. So, we will fight for it.
Yeah.
that it has to be a national hospital if only to serve the people better. Kasi hindi naman, with all due respect sa, limited naman ang kakayahan ng province eh. Ganon din sa amin. So, just imagine, the only component city in my district, which is so populated, 20 bed ang district hospital namin doon. So more often than not, umaabot ng 50, 60, 80, and wala nang silbi. Lahat ng mga pasyente na pumapasok doon, dinidiretso na sa Western Visayas Medical Center. So that defeats the whole purpose. That's why I'm fighting for the nationalization of my district hospital. So I would like to seek the support of the Honorable Chair, in pursuing this particular legislation na dapat national, Congressman Celeste. Thank you, Mr. Chair.
Thank you, Honorable Biron. We now proceed to House Bill number 1383, an act reverting to the national government the discharge of basic health services of the Democrito O. Plaza Memorial Hospital and appropriating funds therefore by Honorables Edibong G. Plaza and Honorable Alfelito Bascog. Honorable Bascog is now recognized.
Thank you, Mr. Chair. Mr. Chair, it is an honor and privilege to sponsor House Bill number 1383, an act reverting to the national government the discharge of basic health services of the Democrito O. Plaza Memorial Hospital and appropriating funds therefore. With the indulgence of the chair, I would like to make a brief manifestation to supplement the explanatory note. For many years, the provincial government of Agusan del Sur has remained steadfast in sustaining the operations of the Democrito Plaza Memorial Hospital, ensuring continued access to healthcare services despite limited local resources. However, as stated in the explanatory note, the hospital has been operating beyond its authorized capacity due to increasing patient demand, placing significant strain on its facilities, funding, and healthcare workforce. In recognition of these realities, we as authors of this measure, together with Kong Edibong Plaza, seek the renationalization of the hospital to secure, sustain the national government support, building upon the strong foundation laid by the provincial government. Under the supervision of the Department of Health, this measure will enhance facilities, strengthen medical services, and expand healthcare capacity for the welfare of the people of Agusan del Sur and neighboring provinces who depend on this institution. In view thereof, we respectfully seek the favorable consideration of this committee for the approval of House Bill number 1A3. Thank you, Mr. Chair.
Thank you, Honorable Bascog. Dr. Reyes of DOH.
Thank you, Mr. Chair. The Department of Health acknowledges the intent of House Bill number 1383, which seeks to be under the direct supervision and control of the Department of Health and upgrade its facilities and services to better respond to the province's healthcare needs. The Democrito O. Plaza Memorial Hospital is a level 2 hospital with 100 bed capacity, currently owned by the provincial management. On the other hand, the province of Agusan del Sur currently has no DOH hospital. In line with the directive of the Secretary of Health to establish at least one DOH hospital per province, the DOH recognizes the strategic importance of nationalizing the DOPMH. This move is consistent with the objectives of the UHC Act, which aims to ensure equitable access to affordable and quality health services while strengthening the province-wide health systems. In view of the foregoing, the DOH expresses its support for the proposed measure, and we will be submitting our recommendations together with our position paper. Thank you, Mr. Chair.
Thank you, Dr. Reyes. Yes, Honorable Kagas.
Thank you, Mr. Chair. May I ask a few questions to Dr. Reyes? If I'm not mistaken, if I heard you right, that the policy of the Department of Health is one DOH hospital per province. I heard you right? Okay. Thank you, thank you.
Yes, Mr. Chair.
At least one.
At least one.
Yes.
Thank you, Mr. Chair.
Thank you, Honorable Kagas.
Mr. Chair. Okay.
Mr. Chair, I move to approve House Bill number 1383, an act reverting to the national government the discharge of basic health services of the Democrito O. Plaza Memorial Hospital and appropriating funds therefore, subject to style and amendment. I so move, Mr. Chair.
Second, Mr. Chair.
There's a duly
Motion.
seconded motion by Honorable Marquez that House Bill number 1383 by Honorable Eddie Bong Plaza and Honorable Alfelito Bascog be approved. Hearing no objection, the same is approved. Okay. Congratulations. We now proceed with House Bill number 169, an act increasing the bed capacity of Valenzuela Medical Center from 500 to 800 beds to be known as Antonio M. Serapio Medical Center and appropriating funds therefore by Honorable Kenneth Gatchalian. Honorable Gatchalian is now recognized.
Thank you, Mr. Chair, and good morning, esteemed members of the committee and to all our resource persons today. Today, on behalf of the people of Valenzuela City, I ask for the consideration of the Committee on Health of House Bill number 169, seeking the renaming of the Valenzuela Medical Center to Antonio M. Serapio Medical Center and increasing its authorized bed capacity from 500 to 800 beds. Now, more than ever, the need for further expansion of Valenzuela Medical has become more urgent. Valenzuela City is among the fastest growing highly urbanized city in the National Capital Region, with its population rising from 620,000 in 2015 to close to 800,000 to date. With a population that has expanded significantly in recent years, patient admissions and hospital utilization have correspondingly increased. Our lone national government tertiary hospital in the cities now operates under sustained pressure. Beds are filled, wards are stretched, and demand continues to rise. This measure responds to that reality on the ground. First, it expands capacity from 500 to 800 beds, allowing the hospital to accommodate more patients, reduce waiting times, and strengthen specialized services. Second, the bill formally recognizes the legacy of former Congressman Antonio M. Serapio, whose leadership and enduring contribution have greatly contributed to the hospital's growth. This is both a forward-looking health investment and a fitting recognition of enduring public service. In view of the foregoing, I respectfully seek the committee's favorable consideration and approval of this measure. Thank you very much, Mr. Chair.
Thank you, Honorable Gatchalian. May we now recognize Dr. Proxidio, the Chief of Valenzuela Medical Center.
Good morning. Good morning, Honorable Chair, Congressman Ciriaco Gato, Congressman Kenneth Gatchalian, and distinguished members of the House of Representatives. Thank you for giving me the opportunity to speak in support of House Bill number 169, which proposes to increase the bed capacity of the Valenzuela Medical Center from 500 to 800 beds and rename it to Antonio M. Serapio Medical Center. I stand before you today to present the reality we face every day in our hospital. Valenzuela Medical Center is the only DOH tertiary hospital serving Valenzuela City, the Camanava area, and the nearby provinces. Our city is the gateway to Metro Manila. Patients from Bulacan and Northern Luzon pass through Valenzuela to seek medical care. In total, we serve more than 8 million people. But our current capacity is no longer enough. Although our hospital is authorized for 500 beds, we are only able to implement 211 beds due to infrastructure limitations. Despite this, our bed occupancy has reached as high as 135.6%. This means we are treating far more patients than our hospital was built to safely accommodate. Our admissions, outpatient consultations, and emergency visits continue to increase every year. Patients wait long hours in the emergency room because no beds are available. Some patients remain in the ER while waiting for ward or ICU admissions. Others have to be referred to different hospitals, not because they should be, but because we simply have no more space. But many hospitals in Metro Manila are also full. Patients and families often do not want to be referred far from their homes. They come to Valenzuela Medical Center because it is accessible, affordable, and familiar. We receive complaints about congestion, long lines, lack of beds, and limited services. These concerns reflect the real challenges of a hospital operating beyond its intended capacity. Long-staying patients, especially those who are critically ill, also occupy a significant portion of our beds. This reduces our ability to admit new patients and worsens congestion. Our infrastructure, human resource, and specialty services are under constant strain. Yet our doctors, nurses, and staff continue to serve beyond what is expected of them. House Bill number 169 provides a necessary and timely solution. Increasing our capacity to 800 beds will reduce the overcrowding, improve the patient access, and allow us to admit patients safely and on time. It will reduce the need to refer patients elsewhere and help decongest the hospitals across Metro Manila. It will strengthen our role in supporting the universal health care and ensure better service for our people. We are ready for this expansion. We have available land and an approved master site development plan. We have a clear and structured plan to build the facilities needed to support the 800 beds and expand the specialty services. We also support the renaming of the hospital to Antonio M. Serapio Medical Center in honor of Congressman Antonio Serapio, who authored Republic Act number 7218 and Republic Act 9421, laws that expanded and strengthened our hospital. His vision helped build the foundation of the institution we continue to develop today. Honorable members of Congress, the reality is simple. Our hospital is already beyond its capacity, but the number of patients continues to grow. Every additional bed means one more patient can be admitted on time, treated properly, and cared for safely. This expansion will allow us to serve our patients better, support our healthcare workers, and ensure that Valenzuela Medical Center can continue to fulfill its responsibility to the people who depend on us. On behalf of the Valenzuela Medical Center, I respectfully express our full support for House Bill number 169 and humbly ask for your approval. Thank you very much.
Thank you, Dr. Poxidio. Dr. Reyes of DOH.
Thank you, Mr. Chair. The Department of Health supports the intent of House Bill number 169, which proposes to rename the Valenzuela Medical Center and increase its authorized bed capacity. The proposed renaming of Valenzuela Medical Center, we do not object. The proposed renaming, provided that the revised name remains consistent with the hospital's mandate and functional classification. To ensure legal and administrative continuity, the department recommends the inclusion of a provision stating that references to Valenzuela Medical Center in existing laws, issuances, and regulations, including those pertaining to bed capacity, budgetary allocations, and institutional privileges, shall continue to apply upon the effectivity of the Act. The DOH likewise supports the proposed increase in VMC's authorized bed capacity from 500 to 800 beds, provided the data that was provided earlier. The proposed expansion is therefore consistent with the healthcare utilization trends and is expected to improve patient access, reduce congestion, and enhance service efficiency. Thank you, Mr. Chair.
Thank you, Dr. Reyes. Honorable Marquez.
Mr. Chair, I move to approve House Bill number 169, subject to style and amendment, an act increasing the bed capacity of Valenzuela Medical Center from 500 to 800 beds to be known as Antonio M. Serapio Medical Center and appropriating funds. Therefore, I so move, Mr. Chair.
Second, the motion,
There's a
Mr.
duly
Chair.
seconded motion by Honorable Marquez that House Bill number 169 be approved, subject to style and amendment. Hearing no objection, the same is approved. Congratulations.
Mr. Chair, yeah, just a brief clarification to our distinguished medical center chief, Doc. Magandang umaga. What is the average census of Valenzuela?
Well, with regards to the, based from the calendar year 2025, the total inpatient admission was around 14,000. That's 13,800 plus, to be exact.
All right. So, what is the actual occupancy?
Well, the license to operate for Valenzuela is 150 beds, and our implementing is around 211. And our bed occupancy rate is around 135.6%. That is roughly around 270 to 280 for in absolute numbers.
So, at any given time, average ang 300 ang...
less than 300 po.
Mga 300.
Yeah.
So, but your LTO is only 150.
Yes po.
So, double.
Double po.
So, but the bill states that right now from 450 to 800. Tama ba yun?
We are mandated by law 500 beds. But right now we're still because of challenges in the infrastructure. We are still waiting for the two infrastructure buildings to be completed by 2026. That would roughly give us around.
So the creation allowed you 500.
Yes.
But the actual occupancy is 300.
300.
But now the bill would increase your actual bed, your licensed bed capacity from 500 to 800 because you anticipate.
Yes, the large number of patients, especially with the implementation of the universal health care and the zero balance billing, we really had a big number of patients who come to our hospital.
All right. So with the completion of your two buildings, ilang beds yon ang...
This will roughly give us around 440 beds.
In total?
In total.
So when we pass your bill to increase it to 800, do you still have enough land or space to accommodate this additional 300 beds?
Yes po, Your Honor. We have an available land that is under usufruct with the Department of Information, the ICT. So and we already have an approved master site development plan that is approved by the Department of Health. So this is in line with the hospital facility development plan.
So the land of the ICT is contiguous to your existing land?
It is owned by the ICT, but it was previously occupied by illegal settlers and some previous employees of the ICT, which was eventually relocated and was through the usufruct agreement was handed over to us.
So the usufruct is good for how many years?
Right now it's 25 years.
Okay, would it be more prudent if you request the ICT to just execute a deed of donation?
We will.
Yeah, because by that time we are all gone. So 25 years baka bawiin na ng ICT 'yon. Sayang naman yung ating yung budget ibibigay sa inyo. I mean, just a thought, to consider. As I suggested to Dr. Lladeres, would you consider also preparing for a working HIS in anticipation of this huge influx once you open your two buildings, your two facilities?
Yes, actually, it is already in the works of our development in the hospital. Actually, it is part of the OPCR of the Department of Health, where all the Department of Health medical centers should have this certain number percentage of electronic information management system in the hospital that is working. But right now, with regards to Valenzuela Medical Center, it's still within 40%, and we're still trying to because the challenge here is the budget for the computers, and likewise right now the software is available, the iHome is, so we are looking forward that this will eventually work for all of us within the Department of Health.
So what part of the operation is digitalized at this time?
With regards to our supplies, with regards to our finance, billing and claims, which is very important because of our PhilHealth reimbursements and PhilHealth submission of our claims.
Pero the rest mano-mano na, like you don't have a radiology information system, laboratory information system.
Laboratory information system we have.
Integrated na siya sa accounting system ninyo?
Hindi pa lahat, hindi pa. We still don't have any radiologic information system, but we have the laboratory.
How about your pharmacy and your central supply?
Central supply, we create our own. We create our own, and but with regards to integrating it to the iHome, it's still not done.
Okay, thank you, Doc. Thank you, Mr. Chairman.
Thank you, Honorable Biron, and thank you, Dr. Poxidio. We now proceed. Before we proceed, we'd like to acknowledge the presence of a committee member, Honorable Ramil Hernandez of the 2nd District of Laguna, and our Vice Chair, Honorable Julio Cesar J. Vergara of the 3rd District of Nueva Ecija.
Mr. Chair, I move that all members present be made as co-authors of this bill 169, Mr. Chair. Thank you.
There's a duly seconded motion with the permission of the author that all those present here this morning be made co-authors of the bill. Hearing no objection, the same is approved. Next is House Bill number 798, an act changing the name of Tondo Medical Center to the Northern Metro Manila Medical Center, increasing its bed capacity from 300 to 500 and appropriating funds therefore by Honorable Toby Chanco, and House Bill number 6207, an act increasing the bed capacity of Talavera General Hospital in the municipality of Talavera, province of Nueva Ecija from 100 to 200 beds and for other purposes by Honorable Micaela Angela Swansing. Honorable Swansing and Honorable Chanco are not present, but our Vice Chair, Honorable Vergara, will sponsor in their behalf. Honorable Vergara.
Thank you, Mr. Chair. May I move to adopt the explanatory note of both House bills to be the sponsorship speech of the said House bills?
Second, Mr. Chair.
I so move, Mr. Chair.
Thank you, Vice Chair J. Vergara. May we now listen to Dr. Reyes?
Estrella. Doctora Estrella po.
Okay. We'll just have Dr. Estrella first before the DOH.
Good morning, Mr. Chair, and to the members of the committee. I am Dr. Maria Isabelita Estrella, the Medical Center Chief of Tondo Medical Center. And first of all, I would like to thank His Honorable Representative J. Vergara of the 3rd District of Nueva Ecija for reading our House bill, sir. Maraming salamat po. And of course, I'd like to acknowledge the major sponsor of our bill, Congressman Tobias Toby Chanco po. Tondo Medical Center supports the changing of the name of Tondo Medical Center to the Northern Metro Manila Medical Center, clarifying its institutional identity. The current name, Tondo Medical Center, has been confused with the Hospital ng Tondo, a hospital operated by the LGU of Manila. This overlap in nomenclature has led to misconceptions among our patients, stakeholders, and partner agencies. Also, renaming the hospital would reflect an expanding catchment area of the hospital because in reality, Tondo Medical Center has been the apex hospital not only of patients coming from the district of Tondo but also coming from the northern Metro Manila, which is the Camanava area, Caloocan, Malabon, Navotas, and Valenzuela also. The increase in the bed capacity from 300 to 500 bed addresses also the increasing patient demand of the hospital. The existing 300 bed capacity of Tondo Medical Center is no longer sufficient to meet the demands for inpatient and emergency room services. At present, we have a total of 9 residency training programs and 2 fellowship programs. So, and at present, we are we have 4 specialty centers as assigned by the Department of Health and 1 specialty center in which we are developing on our own. So to ensure the adequate patient accommodation, we highly support this House bill. Thank you very much, Mr. Chair.
Thank you, Dr. Estrella. Dr. Reyes.
Thank you, Mr. Chair. The Department of Health supports the measure that seeks to rename Tondo Medical Center and increase its authorized bed capacity from 300 to 500 beds and provide the necessary appropriations to support the proposed expansion. For the proposed renaming, we agree that there is a need to provide institutional clarity and appropriate health system positioning. However, the DOH likewise has another hospital named Northern Mindanao Medical Center with the same abbreviation of NMMC to this otherwise NMMMC. With that in mind, the Department of Health will submit in its position paper the recommended change of name. So we are supporting the rename. However, the current proposed name, we have reservations for. On the other hand, for the expansion of bed capacity from 300 to 500 beds, we are also in support of this expansion for the current Tondo Medical Center. Thank you, Mr. Chair.
Thank you, Dr. Reyes. Honorable Prieto.
Thank you, Mr. Chair. I move that the House Bill 798, entitled an act changing the name of Tondo Medical Center to Northern Metro Manila Medical Center, increasing its bed capacity from 300 to 500, and putting funds thereof, be approved subject to style and amendment. Thank you, Mr. Chair.
Second. There's a duly seconded motion that House Bill number 798 be approved, subject to style and amendment. Hearing no objection, the same is approved.
Mr. Chair, I have some clarificatory questions for Doc Estrella. Hi, Doc. Magandang umaga.
Magandang umaga po, Your Honor.
So, with this anticipated expansion, do you have enough land area to accommodate the construction of new facilities?
Yes, Your Honor. As a matter of fact, we did not increase our the request of increasing of more than 500 beds because this area is a reclaimed area.
Yeah,
and a 1.3 hectare area would highly accommodate 500 beds, Your Honor. Thank you.
All right. At present, what is your occupancy rate?
We have at present an average of 110 to 130% occupancy rate, Your Honor.
So from from your LTO of 300, you have at present around 500 patients at any given time. Is that correct?
More or less, sir, Your Honor, 400 patients.
400 patients. Is that during peak season na?
Hindi
During
pa
flu
po.
season?
Hindi pa po, Your Honor, because January to March po is hindi pa po yung peak season.
Oh, so you have
medyo
400.
may i-increase pa po yun, Your Honor.
So during peak season, rainy season, dengue season, umaabot ng 500.
Yes, Your Honor, more or less, because we are the catchment area of all dengue and all leptospirosis cases in the Kamanava area, Your Honor.
So with anticipated expansion of 500, I'm sure the admissions sa census would still exceed 500.
Yes, Your Honor.
So wala tayong magawa kasi reclaimed area siya.
Yes, Your Honor.
Okay, so so mid-rise ang ipapatayo nyo doon.
Yes,
5
Your Honor.
stories at least.
But the increasing bed capacity of Valenzuela Medical Center would gladly
Accommodate.
help the hospital,
Yes.
Your Honor.
All right. Okay, thank you, Doc Estrella. Thank you, Mr. Chair.
Thank you, Honorable Biron. We now proceed with House Bill number 965, an act renaming Dr. Jose Rodriguez Memorial Hospital in the city of Caloocan into Jose Rodriguez Memorial Medical Center and appropriating funds therefore, amending for the purpose Batas Pambansa Bilang 94, entitled an act renaming the Central Luzon Sanitarium at Talas City of Caloocan as Dr. Jose N. Rodriguez Memorial Hospital by Honorable Malapitan. In his behalf, we now recognize Honorable Gatchalian to sponsor the said bill.
Thank you, Mr. Chair. This is to sponsor House Bill number 965. I move to adopt the explanatory note of House Bill 965, authored by Representative Oscar G. Malapitan. An act renaming the Dr. Jose N. Rodriguez Memorial Hospital in the city of Caloocan into Jose Rodriguez Memorial Medical Center and appropriating funds thereof, amending for the purpose of Batas Pambansa Building 94, entitled an act renaming the Central Luzon Sanitarium at Talas City of Caloocan as Dr. Jose N. Rodriguez Memorial Hospital. I so move, Mr. Chair.
Thank you, Honorable Gatchalian. Dr. Reyes of DOH.
Thank you, Mr. Chair. The Department of Health acknowledges the intent of House Bill 965, which seeks to rename Dr. Jose N. Rodriguez Memorial Hospital and Sanitarium as Jose Rodriguez Medical Center to reflect its evolving role in delivering higher-level health services. The department recognizes that the proposed renaming aligns with the facility's expanded function as a comprehensive tertiary and specialty care institution while preserving its sanitarium mandate. In accordance with DOH Administrative Order Number 2005-0013, the hospital shall continue to maintain a leprosy unit. Thank you. Under existing hospital licensure and classification rules, the DOH classifies hospitals based on service capability and functional capacity. Hence, the designation as a medical center is consistent with the facility's regulatory classification and level of services. In practice, Level 3 hospitals, which provide the highest level of care, are commonly recognized as medical centers, which is aligned. Hence, in this case, the hospital is currently an 800-bed tertiary hospital with extensive specialty services, referring capacity, and training functions. Therefore, naming it as a medical center is aligned with us. However, we want to retain the name Sanitaria so that the facility is recognizable as a facility that maintains a leprosy unit. So that is all, Mr. Chair. Likewise, I would just like to add that we may retain the letter N, Jose N. Rodriguez, so as not to confuse with JRR, Jose R. Reyes Medical Center naman po. So since we do run a network of facilities, We try to avoid as much as possible confusion or very prone to typo errors with very similar acronyms across our hospitals. So that is our recommendation. Thank you, Mr. Chair.
Thank you. May one question. Meron bang rules or law sa DOH on naming of hospital ang mga pangalan ng mga tao?
The DOH itself does not have rules for this. We follow what is recommended by the National Historical Commission. So their rules are usually, if they're named after people, at least 10 years post of their death, and others. We usually do one round of staff work with them for their recommendations if it is acceptable to them. If I may also add, consistent with the guidance of the National Historical Commission in the past, we recommend the removal of the word memorial because it is understood that if we are naming a hospital after a person, then it is already a memorial of that person. Thank you, Mr. Chair.
In other words, hindi ka pwedeng maglagay ng pangalan ng buhay pa ang tao. So it has to be at least 10 years?
Yes po, Mr.
Okay.
Chair.
Thank
Likewise,
you.
po, in terms of the naming convention, for example, we cannot name an ambulatory surgical center a medical center. So those are regulatory in nature naman po. So we ensure alignment to those classifications. Thank you, Mr. Chair.
Is there, curious lang ako, marabang conflict with the anti-EPAL law? Thank you. Thank you. Dr. Famaran of the same hospital.
To the Honorable Seriaco Bigato, Jr., Chairperson, Committee on Health, and to the Honorable members of the Committee on Health, good morning. Given the journey of Dr. Rosén Rodriguez Memorial Hospital and Sanitarium,
Can you please talk louder, or maybe you can change the mic?
Good morning. Given the journey of Dr. Rosén Rodriguez Memorial Hospital and Sanitarium from a sanitaria via Commonwealth Act number 161, 1938 to a level 1 General Hospital via Batas Pambansa bilang 94, 1975 to a level 2 General Hospital via Republic Act number 9420, 2007, and finally to a level 3 Teaching and Training Apex Hospital via Republic Act number 11286, 2018. This proposed legislation seeks your humble approval to rename this facility accurately from Dr. Jose N. Rodriguez Memorial Hospital and Sanitarium to Jose Rodriguez Memorial Medical Center, which reflects its present function. Thank you very much.
Thank you, Dr. Famaran. Honorable Gatchalian.
Mr. Chair, I move that the House Bill number 965 to approve the House Bill number 965 subject to style and amendments. I so move, Mr. Chair.
There's a duly seconded motion by Honorable Gatchalian that House Bill number 965 be approved, subject to style and amendment. Hearing no objection, the same is approved. Congratulations.
Mr. Chair, just a
Yes, Honorable
short
Giron.
inquiry for Dr. Famaran. Doc, how many beds ngayon ang Tala Sanitarium?
Sir, by law, it's 800 beds, sir.
800 beds?
Yes, sir. Authorized bed capacity is 459, sir.
So double.
Sir?
Double the what is allowed in your LTO.
Yes, sir.
All right. So, why did you seek the expansion of the hospital from 450 to at least 1,000? Because ang ang subject ng ating House Bill is only the renaming.
Yes, sir. Only the renaming, sir. Not the expansion of the bed capacity. It's already, sir, 800 beds.
It's already 800 beds
Yes, sir.
ngayon. All right. Okay. 800 beds na siya ngayon. But your occupancy is what, 450?
459.
459. Okay. Out of the 800 beds, how many beds are for leprosy patients?
Sir, currently, we have two types of patients in the institution. One are the admitted patients. It covers for all kinds of patients, including leprosy patients. The second group is for the custodial patients, sir. These custodial patients are previous leprosy patients. The problem is they have no families to go to.
So they're permanent residents of
Yes,
your
sir.
hospital?
Yes, sir. 24/7 permanent residents of the institution.
How many of them?
Give or take, sir, around 250 patients.
Wow.
So that will add up to the current bed capacity. They are occupying the 459 beds for the institution pa.
So for custodial patients, 250 na sila.
Yes, sir. Yes,
So
sir.
250 on top of the 450? Ganon?
Yes, sir. Correct, sir.
Oh, on top. So 700 na sila at any given time.
Yes, sir. Yes, sir.
So it eats into your budget.
Unfortunately, sir, yes.
So these patients were abandoned by their families.
Yes, sir.
na?
Abandoned by the family or they have no families to speak of.
So clinically okay na sila.
Yes, sir. They are already free of leprosy.
Okay. So perhaps you can, yeah. And they're not part of the admissions. Ano na lang. So how do you record them? How do you record them as what? Because they're clinically free of from leprosy. So, paano natin sila nire-record sa admissions?
For recording purposes, sir, for patients who are aged, we cover them as geriatric patients. So they will add up to the admissions of the institution.
All right. Since they're clinically free from leprosy, paano if they have some incidental diseases like pneumonia sila while custodial
Yes, sir.
residents, so you record them as
As regular admitted patients.
So they avail also of health benefits.
Yes, sir.
Ganon. Very unique ang
Yes, sir.
situation sa inyo, Doc Famaran.
Oh, yes, sir.
All right. Okay. Thank you.
Yes, sir.
Thank you, Mr. Chair.
Thank you, Honorable Biron. At this point, we'd like to acknowledge the presence of our Chairman of the Committee on Appropriations, Honorable Micaela Angela Swansing, and to sponsor House Bill number 6207, an act increasing the bed capacity of Talavera General Hospital in the municipality of Talavera, province of Nueva Ecija from 100 to 500 beds and for other purposes. By Honorable Micaela Angela Swansing. Honorable Swansing is now recognized.
Thank you very much, Mr. Chair. To the Honorable Chairperson of the Committee, Congressman Siriaco Gato, thank you, sir, for taking up this very important measure for our district. To the members of the committee, my esteemed colleagues, resource persons, good morning. In pursuance of our constitutional duty to promote and protect the right to health of the people, it is my great privilege to sponsor House Bill number 6207 that seeks to increase the bed capacity of the Talavera General Hospital in my district in the municipality of Talavera, Nueva Ecija. The Talavera General Hospital is the only DOH retained Level 2 hospital in the 1st District of Nueva Ecija and currently has an authorized capacity of only 100 beds. It has consistently delivered quality healthcare, ranking 10th in the 2023 DOH Hospitals Performance Report. However, rising demand driven by population growth has significantly strained its resources. Admissions increased by 10% from 2023 to 2024, with an average of 141 patients served daily and a 98.73% bed occupancy rate, highlighting the urgent need to expand and upgrade facilities to ensure timely, safe, and quality care for all patients. Towards this improvement, may I manifest, Mr. Chair, to increase the hospital's authorized bed capacity from the current 100 to 500 beds, instead of the 200 previously indicated in the original version of the bill. The expansion will support the potential creation of a dedicated women and child care section since obstetrics, gynecology, and pediatrics account for 62% of annual cases on average. Additionally, this will cater not only the 1st District of Nueva Ecija, but also bring services to its neighboring cities and municipalities. Mr. Chair, I would just like to add that the Talavera General Hospital currently is the only government hospital catering to the 9 towns of the 1st District of Nueva Ecija. The closest government hospital is the PJG Hospital in Cabanatuan, which is a level 3 hospital. So there is really a strong need to have a strong presence of a government hospital in our district. In view of the foregoing, the immediate passage of this bill is earnestly sought. Thank you very much, Mr. Chair.
Thank you, Honorable Sansing. We now recognize Dr. Gallardos of the same hospital.
Good morning to our chair and our distinguished members of the House of Representatives. I am Dr. Maria Isabel S. Gallardo, the Medical Center Chief of Talavera General Hospital. And also to my Congresswoman who sponsored our bill, Congresswoman Mika Swansing. Good morning, ma'am. We are blessed when former Congresswoman Estrelita Swansing, who happens to be the mother of our current Congresswoman, sponsored the House bill to upgrade the Talavera General Hospital into a Level 2 hospital and increasing its bed capacity to 100 beds. From then on, immense gratitude from every individual of different municipalities was very evident with the equality of health care they receive from our institution. As we are embracing the challenges that came along the way, we are delighted with our growth as we continuously having the strong drive to fulfill our commitment to our clienteles. Furthermore, we humbly request consideration of upgrading our bed capacity to 500 beds. Such designation will institutionalize our strengthened commitment to maternal, neonatal, and pediatric services and enable us to strategically align our infrastructure, human resources, and clinical programs towards improving health outcomes for mothers, children in our district and neighboring communities. Our sincerest gratitude in advance as we are hoping for your most favorable response regarding this request. Thank you very much po.
Thank you, Dr. Gallardos.
Mr. Chair,
Yes, Honorable.
some short clarification for Dr. Gallardo. Doc, the Talavera Hospital is essentially a psychiatry center. Is that correct?
No po, no.
Ay, hindi naman. But I understand na ano siya, mas ang confinement doon more of psych patients.
No, no,
As
sir.
a general
Actually,
hospital.
maybe you are thinking of Maribeles Mental
Okay.
in Bataan.
All right. Yeah, sorry. Yeah, I stand corrected. So, Talavera, in its LTO, it's 100 beds ngayon.
Yes, sir.
All right. Now your Chair Swansing increases it to 500. What is the present occupancy of the hospital?
Actually, we have about 115% occupancy rate po dun sa aming current authorized bed capacity.
All right. So it exceeds, or it goes up to around 200
Yes.
at any given time.
Yes, sir.
All right. So you want it to be 500. But Talavera is not a training hospital, right?
Not yet, sir.
So with the expansion of the bed capacity, would you consider? Because, sayang naman na we have
Yes
a lot of
po.
cases and then hindi siya maging training hospital.
Yes, kinukonsider po namin. Actually, at present, we are departmentalized with increased subspecialty clinics such as gastroenterology, rheumatology, cardiology, and so on and so forth.
All right. So presently, with 100 beds, you have specialized centers
Yeah.
in place right now.
Opo.
So you have enough space for the expansion?
As I've mentioned po to one of my companion here, we just purchased 3,000 square meters of land. Ano po yan? Galing sa income namin
I see.
ng Talavera.
Yeah, but I think you can, with the generous indulgence of the author, she can easily get
Yes.
more land for you, being the chair of the appropriations.
Opo.
Yes. So we sincerely support this initiative of Chair Swan Singh for the expansion of the Talavera. Thank you,
po.
Mr.
Thank
Chair.
you po.
Thank you. Just a follow-up question. Is that a level 2 hospital?
Yes, sir.
Okay.
Level 2 po.
So it's departmentalized, but it's not
Yes.
yet a training
Departmentalized.
hospital. Okay.
Mr. Chair.
Thank you. Yes, Honorable Vergara.
Kailangan po ng Nueva Ecija yon. Ang laki po ng Nueva Ecija ay 5,750 square kilometers. Kaya minumove ko na pagbigyan na natin po.
Mr. Chair.
Yes, Honorable Swan Singh.
Thank you very much, Mr. Chair. Thank you very much, DS, Veron, and Kong Jay for the support. Actually, ngayon po kasi, yun nga po, bumili na po ng 3,000 square meters na lupa yung Talavera General Hospital. Because what's happening now is a lot of the patients now in essentially what Nueva Ecija is catering to is not just patients from Nueva Ecija. There are a lot of patients from Aurora, Nueva Vizcaya, and adjacent provinces who all now go to Nueva Ecija because PJG in Cabanatuan has been expanded. They now have a cardiology center, a very good ophthalmology center, and the like. They performed their first bypass surgery just last year. So, ang nangyayari po, overcrowded na po talaga yung PJG sa may Cabanatuan. So, ngayon po, Talavera General Hospital is roughly 30 minutes away from PJG Hospital in Cabanatuan. So, it's very important for us to be able to expand Talavera General Hospital to also be able to cater to patients all over Nueva Ecija. Kasi ang nangyayari po, ang dami nang galing sa labas ng probinsya na kinikater po sa PJG. So, medyo nawawalan po ng hospital na magkikater po sa mga taga Nueva Ecija. So, I'm so happy when I found out, I was so happy, Mr. Chair, when I found out that Talavera General Hospital recently acquired land, because that was my first question to them. If we support this expansion of the bed capacity, where will we be able to build? I was so happy when I found out that they acquired land from their own income. So it just goes to show kung gaano po kagaling yung performance ng hospital. And
Mr. Chair?
yeah, so
Mr. Chair?
I strongly implore my colleagues in Congress and in the committee to please support this measure.
Mr.
And I'm
Chair.
so grateful to all of our colleagues for the support. Thank you very much, po.
Thank you, Honorable Swan Singh. Yes,
Mr.
Honorable
Chair.
Pleto.
I now move for the approval of House Bill 6207, an act increasing the bed capacity of the Talavera General Hospital in the municipality of Talavera, province of Nueva Ecija, from 100 to 200 beds, subject to amendment and style.
Mr.
Thank
Chair,
you.
if I may request an amendment to the motion, if it may be increased to 500 beds.
500.
No, to 500 bed capacity.
Thank you very much, Mr.
So
Chair.
move, Mr. Chair.
There's a
Second the
duly
motion.
seconded motion by Honorable Pleto that House Bill number 6207, an act increasing the bed capacity of Talavera General Hospital in the municipality of Talavera, province of Nueva Ecija, from 100 to 500 beds, and for other purposes. Hearing no objection, the same is approved. Congratulations.
Now we are done with our we're done with the local bills. We now proceed with the bills of national significance. But before we proceed, we'd like to acknowledge the presence of our committee member, Honorable Henry Waminal Jr. of Asenso, Pinoy. We now move on the deliberation of bills strengthening the national program for the elimination of tuberculosis. House Bills number 664, House Bills number, an act strengthening the national program for the elimination of tuberculosis, amending for the purpose of Republic Act number 10767 or the Comprehensive Tuberculosis Elimination Plan Act by Honorable Attorney Mike Tan. House Bill number 3364, an act strengthening the national program for the elimination of tuberculosis, amending for the purpose Republic Act number 10767 or the Comprehensive Tuberculosis Elimination Plan Act by Honorable Iris Marie Montes. And House Bill number 6219, an act strengthening the national program for the elimination of tuberculosis, amending for the purpose Republic Act number 10767 or the Comprehensive Tuberculosis Elimination Plan Act, an act strengthening and for the purpose for amending for the purpose of Republic Act number 1067 or the Comprehensive Tuberculosis Plan Act by Honorable Christopherson Coco Yap. And House Bill number 7981, an act strengthening the national program for the elimination of tuberculosis, amending for the purpose Republic Act number 10767 or the Comprehensive Tuberculosis Elimination Plan Act by Honorables Percival Sandanya, Honorables Jose Manuel Tadeo Diokno, and Honorable Dada Kiram Ismula, and Honorable Kaka Bagao. In their behalf, we would like to recognize Honorable Iris Montes to sponsor the said bills.
Thank you, Mr. Chair. Magandang umaga po sa ating lahat. I thank the committee for the opportunity to sponsor House Bill 6664, 3364, 6219, and 7981, all seeking to amend Republic Act 10767, otherwise known as the Comprehensive Tuberculosis Elimination Plan Act. It was in November last year, just a few months ago, when this representation took the floor at the plenary to call attention to the WHO Global Tuberculosis Report 2025 that ranked the Philippines third globally among countries with the highest burden of tuberculosis, with an incidence of 500 new cases per 100,000 population in 2024. Also in that year, 739,000 Filipinos got ill with TB and 38,000 deaths from it, or 100 Filipinos dying daily from TB, with notwithstanding the swift approval of Congress of the landmark Comprehensive Tuberculosis Elimination Plan Act more than a decade ago. Mr. Chair, Your Honors, there is an urgent need to strengthen RA 10767 in order for the country to keep track of its commitment in the international international commitments, and to once and for all enhance our efforts in stopping TB in our country. To do that, we need to effectively enforce the notification of TB cases, especially on the part of the private sector, expand TB DOT's benefit package, provide fines and penalties for non-compliance and non-observance of the National Protocol on TB Management and TB Notification, enshrine patients' rights and responsibilities, along with corporate social responsibility, to encourage business corporations to contribute in the ongoing efforts to reduce the incidence of TB in the country and address the problem of indirect costs borne out of accessing TB treatment, such as transportation, accommodation, or halfway house and meals, among other basic necessities. We need a TB strategic plan for local government units, integration of TB services, and established service delivery networks or local health referral system, and provisions of personnel complement, alternative financing schemes, and other sources of funds in order to ensure sufficient and sustainable financing for the country's commitment to end the TB epidemic. Mr. Chair, Your Honors, tuberculosis is a national emergency. It demands our attention, our leadership, and our political will now. Sana po ay hindi lang natin pag-usapan ngayon, kundi umusad na sa lalong madaling panahon ang panukalang ito sapagkat wala na dapat na Pilipino ang namamatay sa sakit na tuberculosis sa ating kapanahunan dahil ang TB ay maaaring iwasan, ito ay pwede nating tuldukan at may gamot at lunas laban dito. Maraming salamat po, Mr. Chair.
Thank you, Honorable Montes. We now recognize Dr. Malbasias from the Department of Health.
Thank you, Your Honor. The Department of Health firmly supports the proposed amendments to the Republic Act number 10767 or the Comprehensive Tuberculosis Elimination Plan Act, as TB remains a high-burden disease not only in the Philippines but globally. Strengthening the law is essential to fully integrate patient-centered TB services within the universal healthcare framework. The DOH backs measures that enhance active case finding, systematic screening, accurate and timely diagnosis, effective treatment, and sustained patient follow-up to ensure better health outcomes nationwide. The proposed amendments reinforce a coordinated multi-sectoral response involving national and local governments, the private sector, civil society, and development partners to deliver a comprehensive approach to TB prevention, care, and control. Central to this effort is a rights-based, people-centered strategy that promotes meaningful participation of communities, patient groups, and TB survivors, reducing stigma and discrimination, safeguarding patient rights, and strengthening community engagement are critical to improving treatment adherence and long-term success. The DOH likewise supports expanding PhilHealth benefit packages to ensure financial risk protection and equitable access to TB screening, diagnostics, and complete treatment regimens for all types of TB and TB infection. Enhancing laboratory capacity, digital surveillance systems, and drug supply chain management further strengthens the country's TB response. These amendments are timely, responsive, and aligned with the national priorities and global commitments towards achieving a TB-free Philippines.
Thank you, Dr. Malbasias. Now, we recognize Dr. Sabido from the PhilHealth.
Good morning, Mr. Chair and honorable members of the Committee on Health. PhilHealth strongly supports this institutionalization of the comprehensive TB registry and notification system, including the integration of TB screening into routine clinical services and HIV programs, and the strengthening of the service delivery networks. These measures will significantly improve early detection, case tracking, and continuity of care. PhilHealth is programmed to release this year an expanded outpatient TB management package, which will provide broader access to diagnostic and treatment services. And this will also strengthen early detection and ensure continuity of care at the outpatient level where most TB cases are managed. In addition, the PhilHealth Yaman ng Kalusugan program, or the YAKAP program, will serve as the initial access point within the primary care system, Through YACAP, the patients will be able to undergo early evaluation, including screening through x-rays and sputum examinations, receive appropriate referrals to DOTS facilities, and be managed in a coordinated manner within the said service delivery network, thus preventing delays in diagnosis and treatment. However, Mr. Chair, PhilHealth would like to respectfully recommend that there be a clear delineation between the DOH and PhilHealth to prevent duplication of services and preserve the sustainability of the program. We also wish to clarify that the extent of the benefit coverage as to whether it includes extrapulmonary conditions or not. And also, we would like to request that the alignment of TB benefit expansions with broader primary care and service delivery network reforms under the UHC Act to include provisions that encourage the primary or private TB care facilities to advise patients to utilize the YACAP services. That's all, Mr. Chair. Thank you.
Thank you. From the Department of Education, Director Leia Apa.
Good morning, Mr. Chair and the members of this honorable committee. I am Leia Bueno Apao, representing the Department of Education, specifically Governance and Operations Strand. The Department of Education expresses its full support for the passage of House Bills number 664, 3364, and 6219, which seek to strengthen the national program for the elimination of tuberculosis. Likewise, DepEd shares the vision of Philippine legislation with the Declaration on the Fight Against Tuberculosis and affirms the country's commitment to end the TB epidemic by 2030, in accordance with Agenda 2030 of the Sustainable Development Goals. DepEd recognizes that the proposed measure designates DepEd as a committee member agency with its vital role to ensuring the inclusion of modules containing principles and practices on preventing, detecting, managing, and controlling TB in the basic education. Mr. Chair, Your Honors, DepEd respectfully informs this honorable committee that DepEd's K-12, a revised K-12 curriculum incorporates competencies that address directly TB, specifically in grades 4 and 6. The competencies are categorized under the health content area of disease prevention and control, where learners study communicable diseases, their nature, methods for prevention and control. As DepEd responds, apart from the inclusion of competencies in the revised basic education curriculum, DepEd also issued DepEd Order Number 18, 2018, institutionalizing health and nutrition services in schools, communicable diseases prevention, health promotion, and referral systems. And to strengthen its effort, DepEd has entered into MOA with the Philippine Tuberculosis Society Incorporated and has successfully launched the TB-free school program, which aims to screen learners, teachers, and personnel with 15 years and above. So henceforth, DepEd reiterates its support to full support for the proposed measures and looks forward to strongly work with the Department of Health and other agencies of the government toward the shared goals of ensuring the health and well-being of every Filipino. Good morning and thank you so much, Mr. Chair and Your Honors.
Thank you, Director Leia Apao. From the TESDA, Attorney Alinaw.
Good morning, Mr. Chair, and to the members of the Honorable Committee. On behalf of TESDA, we would like to extend our full support to the proposed legislative measures. We would like, however, to make a clarification regarding Section 9 on the establishment of focus groups on the establishment of focus groups for clients afflicted with the tuberculosis disease. Since enrollment in training enrollment in TESDA does not require a medical certificate. So we would like to clarify if TESDA is required to have a licensed medical personnel in order for us to comply with this requirement, since TESDA at present has limited medical personnel. Thank you.
Honorable Montes.
Mr. Chair, what may I ask from the resource person, what House Bill number is she referring to?
Can you point out the provision and who's author?
For Section 9, Mr.
Of
Chair.
House Bill
of
number?
House Bill. House Bill number 664, Mr. Chair.
It's not.
Yes. House Bill number 664, Section 9. Yes.
My bill is House Bill number 3364, and I cannot find in the provision of my bill your concern about it. Perhaps, Mr. Chair, I cannot second guess what exactly the reason of the author of that bill intended.
Yes, can you just submit to this committee your recommendation or position on that provision?
Yes, Mr. Chair.
Attorney Alino.
Thank you.
Thank you. Yes, Honorable Cruzado.
I think the said what she was asking is, would TESDA be required to have medical personnel to answer the TB? Perhaps maybe ang suggestion ko lang, yung mga training natin, they shall require chest x-ray or screening sa TB before they go into training. Hindi naman necessary na magkaroon pa ng doktor yung TESDA just to answer the TB menace. Yun naman lang siguro. Yun lang ang understanding ko. Kasi yung mga training naman doon, mga adults naman eh. So they just require, chest x-ray, siguro screening for TB before they go into training. I'd like to manifest, Mr. Chair, my support for this program, about really making serious this TB program, the elimination of TB in our country. Sana challenge ito sa DOH na talagang seryosohin natin to, kasi minsan ang problem doon sa area is palaging nawawalan ng gamot. So once wala nang supply sa gamot, napuputol yung treatment. So yun ang challenge ko sa DOH, na yung mga in charge sa program, seryosohin natin to, kasi tumataas nga ang number ng ating TB. Yun lang po, ma'am. Thank you, Mr. Chair.
Thank you, Honorable Cruzado. Yes, Honorable
Mr.
Montes.
Chair, thank you. I already found the provision that the resource person is referring to. With regard to her question whether or not we need to have doctors to be able to implement the proposed provision, I agreed with the Honorable Cruzado that there is no need. What the section actually intended is for awareness in vocational, in TESDA, so that we will be able to curb discrimination against the disease. So hindi po kailangan siguro na magkaroon kayo, yung focus groups po siguro, mga seminars ang kinakailangan for awareness purposes. Thank
Yes,
you.
Your Honor.
Thank you, Mr. Chair.
Thank you. From the Civil Service Commission, Attorney Ilagan. Attorney Ilagan? Yes.
Good morning po, Mr. Chair. For the Civil Service Commission, we would like to manifest that we support the provision requiring the government workplaces to develop and implement TB prevention policies consistent with national laws and occupational safety and health standards, to institutionalize TB prevention in government agencies, promotes employee welfare, productivity, and safe working environments. However, we respectfully recommend that the provision expressly state, this is particularly on the convergence of TB services, that there should be an express provision stating that the implementation in the government agencies should be subject to existing civil service laws, rules, and regulations, including due process, non-discrimination, confidentiality safeguards, and reasonable accommodation. It is also recommended that a coordination between the Civil Service Commission and the Department of Health may include technical assistance and harmonization with the existing welfare programs. As to Section 15 of House Bill 664 and Section 16 of House Bill number 364 and 6219 on personal complement, we also reiterate our support for ensuring an adequate complement of competent and qualified personnel, provided that the qualification standards strictly adhere to the merit and fitness principle, the 2025 Omnibus Rules on Appointments and Other Human Resource Actions, and relevant CSC issuances on recruitment, selection, and qualification standards. Also, any organizational and staffing modifications must be coordinated with the DBM. We also suggest that there should be mandatory capacity building programs which may be integrated into agency learning and development intervention, which is one of the pillars of the prime HRM standards. Finally, as to the penalties for any government employee who will be found liable for the violations of this proposed bill amending the Republic Act, we underscore that any authority to suspend civil servants must be exercised in accordance with the existing civil service laws, particularly the 2025 Rules on Administrative Cases in the Civil Service, ensuring due process and procedural fairness. We suggest that the bill be refined to clearly define what constitutes a violation for civil servants and to assign the corresponding degrees of administrative liability consistent with established disciplinary frameworks. Thank you, Mr. Chair.
Thank you, Attorney Ilagan. Before we proceed, we'd like to acknowledge our committee member, Honorable Nico Raul S.J. Daza of the 1st District, Northern Samar, and Honorable Carly Gaspi of Pinoy Workers Party List. Thank you. Attorney Dizon from the DSWD.
Good morning po, Mr. Chair, and to all the members of this honorable committee. For the DSWD, we express our support for the proposed measures strengthening the national program for the elimination of tuberculosis, recognizing tuberculosis is not only a public health concern but also a social development issue disproportionately affecting poor and vulnerable households. The department acknowledges the provisions requiring convergence of tuberculosis services where the DSWD may help defray these expenses through our crisis intervention program. Through the assistance to individuals in crisis program po, we have the medical or cash relief assistance that may be given to indigent TB patients to help defray indirect costs of treatment, including transportation, meals, accommodation, and other incidental expenses. Meanwhile, on the inclusion of tuberculosis treatment compliance as a condition for retention in the conditional cash transfer program, it was mentioned po on Section 11 of House Bill 6219 and as well as House Bill 3364. These measures are consistent with the objectives of the 4Ps program to promote health-seeking behavior and ensure that our beneficiaries have access to essential health services. But we just want to further explore how we can incorporate this in the program, since in the 4Ps law, it already defines the conditions beneficiaries must meet to continue receiving cash grants. So we recommend establishing clear referral, reporting, and compliance verification mechanisms for beneficiaries diagnosed with tuberculosis where the DSWD can collaborate po with the DOH, ensuring that if this is implemented, it remains supportive rather than punitive. And it can also be included in the family developmental sessions conducted as a platform for health education, compliance support, and stigma reduction strategy. Yan lang po. Thank you po, Mr. Chair.
Thank you very much. From the Philippine Information Agency, Mr. Ragwa Jr.
Good morning, Mr. Chair, and to the members of this committee. The Philippine Information Agency, PIA, strongly supports House Bill number 664, 3364, and 6219. The proposed amendments strengthen the National Tuberculosis Elimination Framework by modernizing surveillance systems, improving patient-centered services, expanding PhilHealth coverage, and reinforcing multi-sectoral coordination aligned with the Universal Health Care Law and global health standards. The House Bill's provision on stigma reduction, public education, community engagement, and workplace accountability are critical as persistent stigma, misinformation, low health-seeking behavior, and underreporting of TB cases continue to hinder detection and treatment. The PIA welcomes its role under Section 3 of House Bill number 664, 3364, and 6219. Likewise, the agency also accepts its role stated under Section 27 of House Bill number 6219 and 3364, as well as Section 26 of House Bill number 664, all refer to the implementing rules and regulations of the aforementioned legislative measures. As the government's lead development communications arm, the agency affirms its role in supporting TB elimination through accurate community-focused communication initiatives, reaching the periphery and underserved populations. In this regard, Mr. Chair, the PIE respectfully asks this committee to retain Section 10 of RA 10767 that designates the Department of Health as the lead agency in implementing the media campaign component of the law, in coordination and collaboration with the PIA. This arrangement ensures that all technical and medical information used in the production and dissemination of media materials for tuberculosis and prevention is accurate, relevant, and aligned with both the requirements of the law and the needs of stakeholders. PIA supports a whole-of-government communication strategy to ensure every Filipino receives reliable information on TB prevention, testing, treatment, and patient rights. Once enacted, the PIA is ready to collaborate closely with the DOH, local government units, civil society partners, and media stakeholders to operationalize these communication components. As mentioned by one of the principal author, Representative Iris Marimontes earlier, TB remains a major global and national public health threat. These challenges underscore the need for evidence-based, sustained communication strategies to complement medical interventions, improve case detection, enhance treatment adherence, and foster public understanding of TB as preventable and curable. The PIA is committed to strengthening nationwide information, education, and communication campaigns on TB prevention, early diagnosis, stigma reduction, and treatment adherence, particularly in high-burden and underserved communities. The PIA remains committed to working closely with the Health Department and other relevant partners to ensure that the communication components of these proposed measures are effectively implemented. These efforts aim to support Filipinos, particularly those in high-burden and underserved communities, in accessing accurate information, timely care, and a health system that upholds rights and dignity towards a resilient and TB-free Philippines. Once again, Mr. Chair, we thank this committee for the opportunity to present our position and reaffirm the commitment of PIA to advancing a healthier, more resilient Philippines through strengthened communication efforts that uphold the rights, dignity, and well-being of all Filipinos affected by tuberculosis. Maraming salamat po.
Thank you, Mr. Ragwa. And from the Philippine Tuberculosis Society, it's an honor to recognize my professor in College of Medicine, Dr. Camilo Roa.
Thank you very much, Your Honor. And thank you very much for the authors of the new bills that will strengthen tuberculosis control and finally eradication. And I now represent also the Philippine Tuberculosis Society, and we have been very active in working with the Department of Health and the Department of Education and other agencies in carrying out TB case finding and treatment in the country. Your Honor, I manifest that the provisions in all those bills are very nice, and we fully, on behalf of my group, support the adoption, consolidation, and enhancement it will do to the previous TB law. Let me just, since I have the mic, I would like to speak what I think should be focused on as we attack this disease that has survived through the years, a disease that is supposed to be preventable, curable, and we should be able to control. And in fact, Your Honor, the other countries of the world, rates of TB, they have gone down so low, and the rates are still going. Ours is still up and going up. And I, it's hard. We probably should not be discussing what exactly went wrong, but in general terms, I would like to say that reiterate that TB is an infectious disease, and it's so prevalent that it's now, as declared earlier, should be an emergency, considered as an emergency, because for every one case that you do not see now, you do not discover one case now, it will become 10 to 15 next year, and the catch-up program will be very, very expensive, and would have less likelihood of success. Now, treatment takes months, as we all know. The Department of Health is introducing a 4-month regimen for low TB burden cases, but the general treatment is still 6 months. And the nuance here is that the treatment has to be completed, otherwise you create a bigger disaster. Resistant TB, when it happens because of stock out of medications, can not be cured by the usual treatment. And that's a big problem that the Philippines has been identified also as a hot spot, drug-resistant TB. The other thing is in TB, many patients, Your Honor, they don't, when they have symptoms and they might also feel they have TB, they don't go to the center. They don't go to the health facility. They keep it to themselves, and therefore any program should include community penetration, because we will just be dealing with the minority if we don't do that, if we just wait for the patients to come in. So these programs that we are going to enhance should have a very strong community penetration in terms of finding the TB, treating, diagnosing them there, confirming their diagnosis, treating them completely. It becomes a point of care effort, because if you do X-ray and then do sputum, and then when you have to come back for the result and start treatment, a good number will not be there anymore, so they escape again. So it has to be as determined as that to be successful, and so anything that we propose should be able to do this. And finally, Your Honor, that looks like a lot of funding requirements. Yes, but the metrics have been computed, and more recently, last year, the WHO sponsored the publication of the experience in 3 countries. This is Brazil, Georgia, Kenya, South Africa. The people running the research there are mainly from UK, US, the high epidemiologic centers, and they say that for every dollar invested, Your Honor, you get at least 4 back, to as high as 39 back. So it's really a cost-effective way of investing for the country, because a lot more goes back to the country. And you can actually say that if you do not invest in TV, you actually lose money. So, Your Honor, I on behalf again of my organization, I support these bills. They may be requiring more budget. The Department of Health will need more budget. Let's provide it to them so that we can have more actually returns to the country. Thank you very much.
Thank you, Dr. Roa. I agree. Budget is very important in the campaign against tuberculosis. We are very fortunate that we have here a chairman of the Committee on Appropriations, so I'm sure she will be more than willing to help us in the budgetary requirements of our anti-TB program. Yes, next is Dr. Mara Villosa of the Philippine Academy of Pediatric Pulmonologists, Incorporated.
Pleasant morning, Mr. Chair, and to the members of the Committee of Health, and to all our colleagues, especially to Dr. Cha from the Department of Health. Today, we stand not only to support a policy, and in behalf of the Philippine Academy of Pediatric Pulmonologists under the umbrella of our mother society, the Philippine Pediatric Society. So we not only defend this policy, but also the future of our nation, especially our children. As mentioned, tuberculosis remains one of the most preventable and curable diseases, yet it continues to silently affect thousands of Filipino families, especially the most vulnerable population, our children. Childhood TB is often missed, underdiagnosed, and underreported, and this is, in reality, in our statistics. It hides behind non-specific symptoms, mimics other common illnesses, and progresses rapidly when not detected early. When a child develops TB, it is not just like any other medical issue. It is already a marker of an ongoing transmission within household and communities. It tells us that gaps still exist in prevention, screening, and access to care. Therefore, a comprehensive TB elimination plan, as manifested here, must therefore prioritize also our children. This means strengthening contact tracing, expanding access to child-friendly diagnostics, ensuring availability of pediatric formulation, integrating TB screening into routine child health services, especially in the community, scaling up of preventive therapy for exposed children, and it also means addressing malnutrition, poverty, and barriers to healthcare that fuel TB transmission. Therefore, if we are serious about TB elimination in the Philippines, we must be serious about protecting our children. Eliminating TB is not only about curing the disease, it is about breaking the cycle of transmission and safeguarding the next generation. And by supporting this motion, we affirm that no Filipino child should suffer from a disease that is preventable, detectable, and curable. So, on behalf of, again, the PPS, the Philippine Pediatric Society, and the Philippine Academy of Pediatric Pulmonologists, we move forward with urgency, commitment, and collective action. Thank you very much.
Thank you very much, Dr. Maravillosa. And last of our resource person for the anti-tuberculosis campaign is the Executive Director of the Lung Center of the Philippines, Dr. Jobert Benedicto.
Thank you very much, Honorable Chair. I'm here also representing the Philippine College of Chest Physicians, being the current president. So I think my colleagues have already spoken as far as our unwavering support to the bill currently being pushed, and we know that in terms of TB elimination, this should be comprehensive and of course unified in terms of its approach. We would like to volunteer our services if you so need the services of adult pulmonologists, and being a past chair as well of the Philippine Coalition Against Tuberculosis, a coalition that includes patient groups, NGO, and academe. We will be more than willing to be part of that multi-sectoral representation. So we give our full support to the bill. Thank you.
Thank you very much, Dr. Benedicto. Any member? Yes, Honorable Montes?
Yes, Mr. Chair, may I know if the TB program manager of the DOH is with us today?
Yes
TB
po.
program manager. Kayo po yung
Yes
po. May mga ilang katanungan lang po ako, ma'am, particularly to further improve and strengthen itong bill po. I have some clarifications regarding diagnostics, testing, screening, contact tracing, notification, and HIV integration. Ano po. Currently po ba, tama po ba ang data ko? Kasi sabi po ng WHO sa report nila, only 43% of TB cases are diagnosed and reported. Tama po ba?
Based on their estimates, our treatment coverage, so treatment coverage means how many were we able to find and treat compared to their estimates. So last year in 2024, we are at around 73% of the notifications in all forms of TB.
73% po.
Opo. So the estimate po kasi of WHO for 2024 is around 724,000.
Okay.
And 2024 notifications is 544,940.
Pagdating po sa screening, how aggressive are we in terms of screening?
So for screening po, we are not only doing passive case finding. So we are now doing active case finding, which means we are going to the communities. So right now we are being supported by development partners, with their contractors going to the communities together with the LGUs. So they bring the services nearer to the people, and they bring their mobile vans with new technologies such as ultra-portable chest x-ray. So mas napapabilis yung chest x-ray screening. And then we also have what we call intensified case finding. So that means that we also screen not only the patients that go because of cough, but also the other, even if they went there just for sa pilay, pwede rin po natin silang i-triage, no, for TB.
Thank you very much. What about in terms of contact tracing and notification? We already have the mandatory notification of notifiable diseases. So tama rin po ba ang report ng WHO that we are falling behind in terms of private sector reporting of TB cases?
If we compare to our current trend, so in 2018, we are only at 11% private notifications out of all the notifications. But in 2023 and 2024, so 2023, 34%, and then 2024, slight decrease po ng 30%. So this one din po, no, malaking tulong din po yung development partners natin because they also deploy, they augment people, what they call private sector notification officers. So it's with the PhilCat as well po. So sila po yung tumutulong para yung mga private physicians po natin ay maka-notify po sa atin.
But the Department of Health po, aggressive din po ba ang ginagawa ng DOH para to ensure that the private sector complies with the mandatory reporting of notifiable diseases? Ano po currently ang ginagawa ng DOH to improve your numbers in terms of reporting from the private sector?
Okay po. So one thing that we did is, of course, the policy po that we included tuberculosis as a mandatory notifiable disease, and then another po is that we also improved our information system so that the private sector physicians, they can notify on their own. So yung ITs po kasi natin, Integrated Tuberculosis Information System that we have in our public facilities, medyo mahaba po talaga siya. So kung private physician po kayo na mag-isa na walang secretary, mahirap po na mag-input on their own. So we made it into an app and made the field simpler. But we still really have a long way to go in terms of incentivizing our private physicians. And then it also helps that our PhilHealth benefit package also applies naman po to them. But again, we also have to improve them to make it more to cover also the expenses of our private sector.
Thank you po. I will get to PhilHealth in a while. What I'm trying to say is lang, siguro we need to be more aggressive in terms of screening, testing, contact tracing, parang kulang pa po yung effort natin pagdating dyan, ano. Mabanggit ko na lang din po, tungkol naman po sa HIV integration natin, are we doing also enough? Kasi total, di ba, nag-screen na tayo for that. Pwede na ring ma-detect. Hindi na kailangan na magpa-screen pa for TB kasi nag-screen din po tayo for HIV.
We agree po that TB HIV integration is really important since TB is the number one killer or opportunistic infection for HIV patients. So we have as a policy for 15 years old and above that we offer HIV testing to those diagnosed TB patients. And based on our data, out of all the notifications, we were able to offer and successfully they got the test around 90%, but the positivity of the test is around less than 1% naman po so far.
Last na lang po, pagdating naman po sa investment on diagnostics, how far are we in the DOH in terms of investments for mga AI-assisted na, mga modern technologies, AI-assisted screening machines, mga AI-powered machines? So, kamusta po ang lagay ng DOH pagdating sa testing capacity?
Okay po. So for testing right now, what is, we have around 1,000 plus rapid molecular diagnostic machines that we are providing sa DOH. We are the ones procuring for the consumables every year. And then in terms of AI, no, we agree we still have a lot to go to that because it is still not approved by HTA. So we cannot use government funds to procure ultra-portable chest X-ray and even AI.
It's already being taken up by the HTAC, not yet?
Yes, we actually applied for 2 years already, but we still have to produce more cost-benefit analysis and local evidence.
Ma'am, in relation to that, are we still receiving funding from the Global Fund?
Yes, so we are currently
ano
under...
po ang idagdag ko na po, how do we use the Global Fund?
Okay. So we are currently under Global Fund Cycle 7 and we are recipient for 3 diseases, TB, HIV, and malaria. So the Global Fund has a primary recipient, which is Philippine Business for Social Progress. So that's where the fund goes. And then we collaborate with them so that we ensure that the strategies that they implement are aligned with the strategies of the Department of Health.
Are they not allowed to use the Global Fund for the purchase of AI-powered or modern technologies for easier screening and testing?
Actually, we have currently around 70 ultra-portable chest X-ray with AI, and 50 of that comes from the Global Fund. So we are able to experience right now AI and ultra-portable chest X-ray because of the Global Fund support.
And in terms of deployment, ma'am, where do we deploy it? Do we prioritize the GDAS?
Yes, so the ultra-portable chest X-ray is really meant for communities and that are far from the centers. However, right now we have a policy. We just are able to provide a special license to operate for the use of ultra-portable chest X-ray, and they need to be to have a RadTech and to also be attached to a licensed radiologic facility. So those are the current barriers for now for our AI and ultra-portable chest X-ray.
Salamat po sa inyong mga kasagutan. Sa PhilHealth lang po, mabilis lamang po ito. Ano po ang current PhilHealth package ng TB natin ngayon?
Mr. Chair, Madam, are you referring to utilization of the...
Ma'am, what constitutes po the benefit package?
Yes. Okay, thank you for that. Currently, the TB package covers drug susceptible TB management. We cover for the drugs, the labs during what they call the maintenance labs during treatment, and including the counseling and consultation services. So those that constitute our current package.
May I know, ma'am, if it's already in your pipeline to cover also MDR, the multi-drug resistant, and the XDR? Napapag-usapan na po ba? Nasa malapit na po ba yan maging katotohanan o malayo-layo pa? Salamat po.
Madam Chair, I am Mr. Chair. We actually already did a costing exercise last year. We already have a draft set of packages already, which actually were supposed to present to the DOH with equivalent rates. However, this has not yet gone through the EXICOM level or the board level, but our target is really for this year to expand the benefit packages to cover drug-resistant TB cases, the preventive aspect, and the confirmatory aspect. We already have the screening for TB covered in the YACAP program. And that is where I was raising a while ago our concern because this House bills concentrates only on the treatment of TB. There is no provision for PhilHealth to develop confirmatory or preventive TB packages in it. So, but however, we are in negotiation or collaboration rather with the DOH already on those cascades of care to be covered. Thank you.
Maraming salamat po, Mr. Chair. Yun lamang po ang ilang katanungan ko. Let me just also support and reiterate yung sinabi po ni Dr. Roa na totoo po, if we invest in TB, we gain a lot, and if we don't, we lose a lot. And also, may I add that it deepens cycles of poverty. Thank you, Mr. Chair.
Thank you, Honorable Montes. Just one question from the Department of Health. How much budget is allocated for this year for your anti-tuberculosis campaign?
For 2026, now we received 4.2 billion, which is a good increase from our 2025, which is around 2.6 billion.
You think the 4.2 billion, that is outside of yung sinasabi ni Honorable Montes na global, is that? Global fund. That's 4.2 billion.
Yes, that's for
plus
our
the global fund na
yes.
ma-receive nyo. You think the 4.2 billion is enough?
No, no po. So,
how much do you think is enough?
We have we just recently released the Philippine Strategic Elimination Plan 2025 to 2030, and we have costed how much is needed for that plan to be implemented. And for 2026, ideally, we should have around 22 billion pesos. Yes po.
22 billion.
To implement all the strategies that is
So,
indicated
as
in
of
the
now,
Philippines.
nasa 4.2 pa lang tayo.
Yes.
Okay. Malayo pa. So, Chair Swansing is here to listen. Yes, Dr. Roa?
Yes, Your Honor, I'd just like to comment on the drugs. Because for the last 3 years, we are lacking drugs. And there's supposed to be money. The Secretary told me. And yet, we don't have drugs. And what's happening? And if you don't have drugs, not only you court resistance, our people cannot go to the community, because what do we have to offer if we find TB? So it impacts all the aspects of TB care if you don't have drugs, and these drugs by the nature of the disease and the type of population we see should be given free by the government. So I hope we can remedy that situation. For example, I'm not very clear with government procedure, but I think when you try to do a annual budget for a disease that requires a treatment that is 6 months, and the treatment straddles 1 year more, mahirap na pagka walang manalo sa bidding next year, maputol. So maybe it can be a multi-year budgeting, ma'am. And also the estimate is based on new cases, the incidents, and they actually put there 80% of the new cases. Why not 100%? And actually, if we are going to play catch up, we have also to include the prevalence, meaning the old cases that has not been discovered the previous year, and therefore the estimate should be a lot more. And that's probably the reason why, Dr. your estimate, if we have to do it ideally, should be 22 billion rather than 4 billion. So really we have to do something here, because as we mentioned, this is a like an emergency, and like in COVID, we have to do something rather quickly and decisively. We have to do it also for TB. Thank you very much.
Thank you, Dr. Roa. Yes, indeed. Napakalaking problema talaga ng TB. We are, correct me if I'm wrong, there are around 70 people dying every day sa Pilipinas because of tuberculosis, or more or less.
Yes. Yes,
sometimes maybe even higher.
It's higher now. That's what the figure I cited, 70-75, when I was starting being a specialist. Now I'm already retired. It's actually higher now. So I don't know. And when we go meet with other people in other countries, nahihiya na halos ako. Bakit walang nangyayari sa atin? So, thank you.
Mr.
Thank
Chair.
you. Yes, Honorable Montes.
Yes, I'd like to support the call of Dr. Roa, and since the chair of the honorable chair of the Committee on Appropriations is here with us today, might as well take this opportunity to appeal to her to increase the funding for TB for next year, unless we want to remain sa number 3 year after year in TB ranking all over the world. So, thank you, Mr. Chair.
Yes, Honorable Sonsing.
Thank you very much po. It's funny when I'm in committees to sponsor my local measures, I'll put on the APRO chair hat na rin po. Of course, I'm very supportive of increasing funding for tuberculosis, programs that address tuberculosis. And siguro my request lang po to our DOH family, since it's currently the budget call, ongoing na po yung budget call for the 2027 budget. My request po to the DOH family is please put this under Tier 1. Paki-prioritize din po yung funding, and para po when the NEP comes out, whichever is not there in the NEP, we can supplement it on the part of the House. We have our colleagues here, we have Chair Gato here, will all be fully supportive of funding it. But our request po is, as much as possible, if that can already be included in the budget preparation stage, when the NEP comes out, isama na po natin. Magtulungan po tayo para po masigurado na come next year, once the 2027 budget comes out, the TB-related initiatives po are addressed and well-funded for next year. Chair, my full support po to the initiatives.
Thank you, Honorable Sonsing. It's a very refreshing and welcome news coming from no less than the chair of the Committee on Appropriations. The full support for funding the Department of Health needs.
Thank you po.
Okay, so anyone?
Mr. Chair.
Yes,
Sana po
Honorable
hindi lang po kasi budget na ngayon, ilalagay po sana ninyo yung actual talaga na nakikita nyo. Kasi during sa mga RHUs, naku-cure nga, and then sudden nag-stop, wala na pong gamot. Actually, yun po yung nangyayari. So, wala pong compliance sa gamot. So, it's always failure and then XDR, MDR sila. And then, mas malaki na naman yung budget ng mga MDR. Why not yung preventive muna tayo, yun sana yung phase 1 and phase 2 ng TB treatment natin, yun dapat yung talagang tutukan natin. On the second kasi, usually, the 2 to 4 months na treatment ng patients, nagfa-fail na eh. Pag pupunta na yung pasyente, wala nang gamot. So, ilang araw na yon, wala na. So, na-loss mo na yung patient. Hindi na talaga babalik sa'yo. So, why not na yun talaga ang ilalagay nyo doon sa budget natin? Because doon sa MDR, though madaming namimiss na mga TB cases natin, especially in Metro Manila. Because siguro yung contact tracing na sinasabi po Nina sa pedia at saka sa pulmo adult na hindi talaga natin na-detect. And then the physicians, the private physicians, they're not reporting it. Ang ginagawa na lang nila kasi due to sa PhilHealth PHIC na nakukuha natin, parang hindi na sila nagre-refer sa mga rural health units for the treatment. And then, pag hindi na sila makabili nung mabibili sa private, pupunta na sila sa mga RHUs, hindi naman nabibigyan ng mga RHUs dahil hindi sila yung nag-treat doon sa mga patients. Am I right to our DOH resource person?
Ideally po the referral from the private sector should be assessed again by the public health physician. So, but usually naman po kung meron pong complete po na laboratories and they also have the medications nga po, enough medications, they are able to provide po. Ang nangyari nga lang po ngayon kasi yung reality nga po natin ngayon medyo may shortage tayo ng medication. So, right now, they prioritize bacteriologically confirmed patients. Yun po.
Yes. For how many years na po tayo sa TB, sa DOH, bakit hindi po natin nasosolve po yan? For how many years na rin po kayo sa DOH po, bakit hindi po natin nasosolve yan sa treatment for TB? That's why our cases in the Philippines increasing siya. Dahil sa contact tracing natin, ang hindi pa natin nakikita lang natin is the adults. Ang hindi natin nakikita are the pediatrics. Yung mga bata na nahawa dun sa mga adults. Diba? So, andito din ang PhilHealth. May package ho ba for the, I think, yung treatment package for the PTB adult, for ang sabi po nila is 1,017 per patient, and then 20,000 for the medications. Tama po ba sa PhilHealth?
PhilHealth?
Mr. Chair, Honorable Congresswoman, the 1,700 actually refers to the YACAP capitation, which is supposed to be the initial step to screen and identify TB cases. But otherwise, the TB package, which covers drug-susceptible TB cases, is actually at 7,800 currently, which has increased last year from a previous rate of 4,000. So it's 7,800 currently.
Mr. Chair, kasi pag pupunta din mga nag-MDR na sila, ang talagang gagawin po sana natin, magtulungan po ang gobyerno for the first phase and then the second phase, continuing phase ng treatment ng mga TB cases natin. Kasi malaki yung nailalagay nating pondo sa MDR, sa mga XDR natin. Kasi malaki din yung payment for the medicines na kailangan dyan. Why don't we do na doon sa budgeting ng DOH, doon talaga kayo maglagay kasi meron naman kayong data for the previous 2024, 2025 cases. Dapat medyo kasi nangyayari, wala na sa region yung gamot. Siyempre, of course, wala na pupunta sa barangay. Yun po yung nangyayaring katotohanan sa Pilipinas po. So, nasa 2026 na po tayo for the budget. Hope it's not only the adults, kasi yung pediatric dose din, pag minsan, Mr. Chair, ang ginagawa ng mga nasa barangay, yung mga BHWs, yung mga midwives, kinakat na lang nila yung malalaking tableta, binibigay nila sa hindi talaga pediatric dose. Sana po, hindi talaga iniinom ng bata. Kaya lumalawak yung ating, yung mga cases natin. Hindi ho ba natin nasa yung forward sana yung ating pag-iisip para ma-eliminate natin. Like the malaria, bakit na-eliminate na? 'Di ba? The elimination of the malaria, it's na siya kasi talagang yung Global Fund tumulong sila noon. Nandito din pala ang Global Fund for this project. Why not na yun ang tutukan ng Global Fund? Kasi wala naman na yung malaria eh. So nag-graduate na lahat yung mga probinsya na nandoon yung malaria. So yun lang po, Mr. Chair. Hope the Pediatric Society, the PEDIA, sila din po yung magbibigay kung karami ng mga bata na nadadiagnose nila sa mga clinics nila. Yun din po sana ang ia-add natin, Mr. Chair.
Thank you, Honorable Aguiao. I hope the DOH has duly noted the recommendation and suggestion of Honorable Aguiao.
Chair,
Yes.
I-add ko lang po. Doon po sa portable na sinasabi, right? Doon sa portable x-ray to the community, lahat po ba ng mga probinsya natin sa Pilipinas na napupuntahan ng portable x-ray na yan? Mr. Chair.
If based po doon sa Global Fund na provision, so they have targets po per region. So for example, in 2025 they were able to screen a total of 1.1 million individuals using that portable x-ray across the regions. But we will have to check po if all the provinces and municipalities were covered.
Yes, Mr. Chair. Thank you. Pero yun sana, ang tinatanong ko rin po, malaki kasi yung gap nung sa mga tawag nito, yung misdiagnose. Though may mga misdiagnose, mistreatment, kaya sila namamatay sa mga pasyente natin. So, sana yung portable talaga na x-ray, it would be a good help para sa ating treatment procedures para sa mga physicians natin sa mga liblib na lugar. Yun lang po, Mr. Chair. Thank you.
Thank you, Honorable Aguiao. Any member?
(664) House Bill 3364, House Bill 219, and House Bill 7881, strengthening the national program for the elimination of TB, amending for the purposes of Republic Act Number 10767 or the Comprehensive Tuberculosis Elimination Plan Act. So move, Mr. Chair.
Second.
There's a duly seconded motion by Honorable Cruzado that House Bill number 664, House Bill number 3364, 6219, and 7981 be approved in its consolidated and substitute bill form, subject to style and amendment. Hearing no objection, the same is approved. Congratulations.
At least.
Co-author?
Mr. Chair, I move that all members who are present here would be co-authors of these bills.
There's a duly seconded motion that all those who are present here in this meeting who wishes to be co-author be made co-authors. Hearing no objection, the same is approved. Maraming salamat, our resource speakers for the anti-tuberculosis. You may now be excused. Our next agenda is the bills on mandatory immunization program. Since I will be sponsoring one of the bills, I will now yield the gavel to Honorable Cruzada to preside.
Mr. Chair, may add lang po ako kasi alis na yata si Kong Swansing. Alis po ba? Si Kong. Ayaw talaga. Kasi ang pinakamalaking problema din sa DOH, I think is the vaccine. Until now, parang on and off din sila eh. Kaya dumadami yung mga pasyente natin. So mga OPB, mga gano'n, parang ang procurement nila ngayon, last December, and then ibibigay nila sa mga munisipyo ng mga expired na. Ganon yung nangyayari. So, yun din po, yung concern sana ng DOH, I know, kasi yung mga barangays, mga munisipyo, ang laking problema nila ngayon, wala daw vaccines. Tinawagan din ni kung gato kahapon si SEC, wala daw available. Nag-stop yung mga vaccination natin. So, later siguro, kung sana yung DOH talaga, hindi ko rin talaga alam kung hindi sila na prino-program sana nila kung magkano talaga, kung ilan talaga yung ginagamit ng mga bata for the protection of our children. Yan lang po, Mr. Chair. Thank you, Kong.
Thank you. So shall we proceed with the deliberation on bills on the mandatory immunization program? I'd like to call on Representative Ramil Hernandez for his House Bill number 2502.
Maraming salamat, Mr. Chair. Ang House Bill number 2502 o ang Mandatory Immunization Program Act ay isang malaking hakbang upang gawing mas mataas o mas matatag at inklusibo ang ating public health system. Sa kasalukuyan, ang ating Batas Republic Act 10152 ay nakatutok lamang sa mga sanggol o mga bata. Bagamat napakahalaga nito, may malaking puwang o gap ang ating sistema. Paano naman ang mga adolescents? Paano ang ating mga adults? Paano ang ating mga senior citizens? Ang mga sakit gaya ng tetanus, diphtheria, pneumonia at influenza ay hindi namimili ng edad. Kinakailangan natin ng bagong batas na ito sa mga sumusunod na kadahilanan. Una, life stage approach. Pinapalawak natin ang saklaw ng mandatory immunization mula sa pagsilang hanggang sa pagtanda. Layunin nating magkaroon ng lifelong immunity ang bawat Pilipino. PhilHealth integration. Ito ay mahalagang bahagi para sa ating mga kababayan. Minamandato ng batas na ito na isama ang mandatory immunization services sa PhilHealth benefit package. Nangangahulugang ito na hindi na magiging pabigat sa bulsa ang pagbabakuna dahil may suportang pinansyal mula sa gobyerno. Libreng bakuna. Sinisiguro natin na ang mga bakunang ito ay mananatiling libre sa mga pasilidad ng gobyerno, pampublikong paaralan, at maging sa mga pribadong pasilidad na PhilHealth accredited. Expert-driven policy. Itatayo natin ang National Immunization Technical and Advisory Group. Isang grupo ng mga eksperto na titiyakin ang mga bakunang ibibigay natin ay ligtas, epektibo at based sa pinakabagong siyensya. Mr. Chair, mga kasama, ang pag-iwas sa sakit o prevention ay laging mas mura kaysa paggamot o cure. Sa pamamagitan nito, hindi lamang natin pinoprotektahan ang kalusugan ng bawat individual, binabawasan din natin ang gastusin ng pamilya at ng gobyerno sa mga sakit na maaari nating iwasan. para sa kalusugan ng lahat, mula sa sanggol, lolo at lola, hinihiling ko po ang suporta ng komite sa pag-aproba ng panukalang ito. Maraming salamat po.
Thank you, Congressman Ramil Hernandez. I'd like also to call on the rest of our representatives who would be sponsoring almost the same bills just like this. For House Bill number 1, Mary Montes.
In the interest of time, Mr. Chair, I'd like to move that the explanatory note of House Bill 1386 be considered as the sponsorship speech. I so move, Mr. Chair.
Thank you, Representative Montes. Next would be House Bill number Okay. I'd like to call on Congressman Nominal for House Bills 2039, 2225, and the rest of these bills.
Thank you, Mr. Chair. I was informed, Mr. Chair, that the authors of the said House bills had prior commitments today, and I was requested to sponsor the respective measures. And I move, Mr. Chair, that their explanatory notes be adopted as the respective sponsorship speech of House Bills number 2039, 2225, 3143, 3769, 4498, and 5113, Mr. Chair.
Thank you, Congressman Nominal. So I'd like to call on also for Representative House Bill 1954 by Representative Siriaco Gato.
Thank you, Mr. Chair. In the interest of time, I will move that my explanatory note be adopted as my sponsorship speech. If I may add, I fully support the other bills on the mandatory immunization. Ang hinihiling ko lang ay maisama ang vaccination on pregnant mothers because I think the data shows that tayo ay nangunguna sa region in terms of maternal mortality rate sa region, and most of the causes of this maternal mortality rate ay isa doon ang infection, and most of the time these are preventable infections if vaccination could have done. So kailangan natin maisasama itong TDAP vaccination on mothers, not only for the mothers but to their babies as well. In this light, I'd like to appeal for the support of this House Bill number 1954. Thank you, Mr. Chair.
Thank you, Congressman Gato. And after this, I'd like to call on our resource person. The first would be the Department of Health, Yusik Chong. You're recognized, ma'am.
Good afternoon, Mr. Chair. Good afternoon, honorable members of the committee. I would like to read, the Department of Health recognizes the intent of the House bills which seek to amend Republic Act number 11152, otherwise known as the Act providing for mandatory basic immunization services for infants and children. The Philippines remains high risk for vaccine-preventable outbreaks for vaccine-preventable diseases such as measles, rubella, and polio. This is the result of low immunization coverage rates, leading to an increase in the number of susceptible cohorts. For the past 5 years, 2018 to 2022, the coverage of fully immunized children ranged from 60 to 70%. That means around 700,000 children annually miss the routine vaccines, and that around 3 million children under 5 years old are projected to be susceptible to measles and other vaccine-preventable diseases. Because of this, mandating the vaccination of children with vaccines against the most common vaccine-preventable diseases will curb the transmission of infectious microorganisms and eventually assist in our long-term goal of healthy Filipinos who are protected against various vaccine-preventable diseases. With this, the DOH fully supports the legislation. Further, the DOH would also like to offer the following recommendations for your kind consideration. to ensure the continuity of health education and promotion of immunization in the community by including the expanded program on immunization in the school curriculum of grade school, colleges and universities, and vocational training courses through collaboration with agencies such as DepEd, Commission on Higher Education, and TESDA, to ensure the steady availability of vaccines by including provisions to streamline its procurement process through issuance of special permits or procedures as deemed legally acceptable, to highly encourage the active participation of local government units in the implementation of the National Immunization Program through the inclusion of provisions that will mandate the augmentation of their human resource for health, financial operational costs for immunization, support of the integrated immunization registry and monitoring, and other health promotion strategies. Lastly, to consider including a provision of minor penalties for parents or caregivers who, after due notice, consciously neglects their duty to provide their children utmost protection from vaccine-preventable diseases. Thank you, Mr. Chair.
Thank you, Dr. Achong. Do you have a question for a resource person, or for the interest of time, I'd like to call on another resource person? The Philippine Health Insurance PHIC, Dr. Sabido.
Mr. Chair, honorable members of this Committee on Health, PhilHealth strongly supports the intent of the proposed measures to strengthen the national immunization program, expand protection against vaccine-preventable diseases, and institutionalize a national immunization technical and advisory group. These initiatives will advance preventive or health care, enhance our financial risk protection, and reinforce national immunization goals. As a national health insurer, PhilHealth is committed to advancing healthcare reforms and working collaboratively with the DOH and other stakeholders to support the effective and sustainable implementation of the national immunization program. PhilHealth respectfully underscores that any expansion of benefits or inclusion of additional vaccines in the PhilHealth benefit package be undertaken in accordance with the HTA and actuarial evaluation mandated under the UHC Act to ensure program sustainability. Aligning NITAG recommendations with the HTA process will help ensure that decisions remain evidence-based, transparent, and fiscally responsible. PhilHealth also recommends continued coordination with the DOH to clarify financing responsibilities and avoid duplication of the services, recognizing the DOH's primary role in vaccine procurement and program implementation. Clear financing alignment will strengthen interagency coordination while safeguarding the sustainability of the National Health Insurance Program. Having said those, Mr. Chair, the PhilHealth already has newborn care package and maternity care package that includes already certain vaccines. Like for the newborn care, we already cover the BCG and Hepa B first dose or birth dose in its package. And also under the maternity care package, we also cover tetanus toxoid in the antenatal care component of the maternity care package. Thank you, Mr. Chair.
Thank you, Ma'am Dr. Sabido. At least we have been informed that PHIC is really financing some of this immunization program in private and government hospitals. So I'd like to call on another resource person. Department of Education, Director Apao.
Good afternoon, Mr. Chair and dear honors. The Department of Education manifests its strong support for the intent of House Bills number 1386, 1954, 2039, 225, 2502, 3143, 3769, 4493, and 5113 on Mandatory Immunization Program Act. Mr. Chair, Your Honors, DepEd will submit its official position and recommendation, if necessary, to support the passage of the aforesaid or aforementioned House bills. Furthermore, DepEd remains committed to collaborating with the Department of Health and other government agencies to ensure healthy Philippines, specifically our Filipino children. Thank you very much, Mr. Chair, and your honors.
Thank you, Madam. Ma'am, I think you have also nurses in your DepEd who can assist us on this. We will be working with that and ensuring that these children who are enrolled in elementary should have the coverage of this immunization that are necessary.
Well noted, Mr. Chair. Thank you very much.
Our next resource person would be from the PNA, Dr. Dimatulak. You are recognized. Andyan na siya? Wala siguro. Are you around, Dr. Dimatulak? What can you say?
Thank you. Good afternoon, everyone.
PNA?
Yes, Philippine
PMA?
Nurses Association.
PNA.
Philippine Nurses Association.
Philippine Nurses Association, ma'am.
Yes. So, in behalf of the Philippine Nurses Association, we respectfully express our strong support for the House bill strengthening the mandatory immunization program. Immunization remains one of the most effective and life-saving interventions, and nurses are at the forefront of vaccine delivery, ensuring safe administration, maintaining cold chain integrity, monitoring adverse events, and educating communities to address vaccine hesitancy. We commend the honorable authors for advancing measures that aim to improve vaccine coverage and restore public trust in immunization. While we express support for these measures, the Philippine Nurses Association respectfully underscores that successful implementation requires parallel support for the healthcare workforce. The Philippine Nurses Association stands ready to support these initiatives for this honorable committee. Maraming salamat po.
Thank you, ma'am. Thank you also for the nurses who is supporting us in these programs. The next resource person is UP Institute of Health, Dr. Lang.
Honorable Chair and honorable members of the committee, good afternoon. On behalf of our Executive Director, Dr. Maria Alejandria, who is feeling under the weather at the moment, I am Dr. Hilton Lam from the Institute of Health Policy and Development Studies, and with me is Dr. Tita Uy, Director of the Institute of Child Health and Human Development. Please allow us to respectfully express that effective and safe vaccines for immunization is one of the landmark discoveries in medicine and modern public health. So we believe that immunization can benefit Filipinos at all ages. Thus, we support the push for a national life course immunization program. We endorse the existing list as expressed in the House bills, but we propose that the mechanism for inclusion be streamlined through the NITAG instead of having to seek approval from hearing, but with periodic reporting by the NITAG to Congress for monitoring and evaluation on the effectiveness and future-proofing of this proposed national immunization program. We will submit our more detailed position statement post-haste. We will include details on recommendations for inventory management, IMS, monitoring and evaluation, maybe even the price negotiation board and management of conflicts of interest, because when we talk about vaccines, the Philippine government does not produce our own vaccines yet. So that risk may open po. So we thank the committee for inviting us. Thank you po.
Thank you, Dr. Lang. We are looking forward to receive your position paper as part of our information. Because if you have a working group, then we will be able to include your recommendations. Thank you. Our next resource person is the members from the Philippine Foundation for Vaccination, represented by Dr. Tabora.
Good morning to the Honorable Chair. I am Dr. Tabora, Charissa Tabora from the Philippine Foundation for Vaccination. We support all of the bills that have been proposed, but maybe if this could be lumped in one called the National Immunization Act that shall have the following: strengthen the national immunization program. A lot has been said, but to make sure that there is a provision that ensures vaccine security and availability, because this measure will now address the problem on vaccine availability and security, which we are having at this point. Number 2, to define the life course framework, which is to include scheduled categories such as newborn and infancy, early childhood, adolescent, adults, elderly, pregnant women, and special risk groups that would include healthcare workers, the immunocompromised, and outbreak settings, because we've seen that in the last COVID. Number 3, to create a dynamic updating clause so that we don't keep on going back and amending the bill, that the schedule shall be determined and periodically updated by the Department of Health based on recommendations of the National Immunization Technical Advisory Group or a duly constituted independent body of experts guided by scientific evidence, disease burden, cost effectiveness, and public health needs. So this now prevents the law from becoming obsolete, because whenever there are new antigens that are introduced in the market, then we can update them periodically because of this clause. And we were just discussing with my colleague, Dr. Anna, who will also present an additional points on this. I just have personally qualms on the use of the word mandatory, because in the past, as we've seen in COVID, we've seen the word mandatory and there's a negative connotation to it. We suggest to be reframed as requirement for school entry, requirement for healthcare worker employment, requirement during outbreaks, so that this is in operational provisions and not in the title. That's all, Your Honor.
Thank you for your comment, ma'am. And thank you also for coordinating with the program, National Immunization Program. I'd like to recognize also Dr. Ong Lim for her position.
Thank you po, Mr. Chair, and the members of the committee for the opportunity for our CSO to provide comments about this very important legislation. So kung titignan po kasi natin yung problema ng immunization coverage sa ating bansa, madali po sana kung simple lang ang sagot, pero marami po talagang parte na kailangan nating strengthen. So medyo kakaiba po tayo kumpara sa ibang bansa, kasi po ang pulisya nanggagaling sa central pero ang implementation nanggagaling sa local government units. And dahil po yung ating proseso ay hindi po nakalatag lamang sa isang organisasyon, hindi mahirap maintindihan na nagkakaroon po talaga ng gaps dun sa ating proseso. So siguro sa amin po sa Philippine Foundation for Vaccination bilang isang CSO na karamihan po ay nasa private sector, ang isa pong magandang ma-institutionalize sa atin pong National Immunization Act yung benchmarking against global standards. So ano pong ibig sabihin nun? yun pong ating mga proseso sa pagpili ng mga bakuna na ipapasok po natin sa ating programa, bigyan po natin ng pagkakataon yung ating mga technical experts na magbigay po ng kanilang abiso base po dun sa current evidence and health technology assessment. So ito po yung trabaho ng NITAG, which I am glad to report is already operational. At alam ko po yun kasi ako po yung chair, so I would like to disclose that. Ang amin pong role ay magbigay po ng input sa ating National Immunization Program kung ano po yung naaayon at ano po yung kinakailangan sa ngayon. So yung pong mga proposal ng ating mga legislators na ilista po yung mga bakunang ibibigay at ipadadaan po sa ating mga komite dito sa ating House at saka sa Senate, kung maaari po para mas maging responsive ay sa NITAG na po natin iasa. And we can assure you that we will be using the evidence, no, and health technology assessments to provide cost-effective recommendations sa ating programa. So, pagka napili na po natin yung bakuna, ang susunod naman po nating problema ay yung procurement. So marami pong pieces of the puzzle na nagiging problema doon kasi po minsan wala pong supply, katulad na po sa ating sitwasyon ngayon na wala po tayong oral polio vaccine. Kahit po gustong-gusto nating mag-procure ay wala pong makuha. And meron naman pong mga pagkakataon na yung nakakasali po sa ating mga proseso, hindi naman po sila yung reliable suppliers. So siguro po, pwede pong pag-isipan ng ating mga proponents, yun pong proseso, kung pwede ba maging multi-year ang ating procurement, para po maging stable yung ating programa. Hindi po, darating pa lang po yung supply para sa taon na to ay mauubos na po yung susunod. So medyo impact po yun doon sa ating operationalization ng ating proseso. So sana po pag naayos naman po yun, doon naman po tayo pupunta doon sa mga nagbabakuna. Ang balita po namin sa ground, dahil mabilis po ang turnover ng ating mga health staff sa ating LGUs, yun pong marunong na po, unfortunately, wala na po sa sistema at kailangan na naman po natin mag-train ng panibago. And finally, doon naman po tayo doon sa tatanggap ng bakuna. Hindi po natin mapagkakaila na meron na pong konsepto ng vaccine hesitancy sa ating bansa ngayon. So, yun nabanggit po kanina na kung pwede po even in our school system, kasama po yung education about vaccination and vaccines and the benefits of vaccines, maganda po yun kasi subasakay po yun sa konsepto ng pre-banking. Ibig sabihin, bago pa natuto ng mali, yung kabataan, na ituro na po natin yung tama para pag nakarinig po sila ng mga faulty health information, alam po nilang sabihin na, ay, parang hindi yata tama yun, hindi po yan sinabi sa akin ng aking teacher. So, inunahan na po natin. And finally po, yung ating electronic data capture system. So, marami po tayong mga gaps in terms of recording. And in fact, pwede pong sabihin na maaring mababa yung ating coverage kasi yung ating pong denominator, yung number of people in a locality, ay hindi naman po natin nakaka-capture ng tama. So sinasabi po ng ating vaccinators, lahat na ng bata na bakunahan na namin, 2 bigay namin pero hindi pa rin kami 100%. So kailangan pong magkaroon ng improvement sa ating data capture system. So marami pong salamat sa pagkakataong to, and sana po lahat ng mga suggestions ng ating mga resource speakers will be considered. Thank you so much.
Thank you, ma'am. So the floor is now open for questions and discussions.
Mr. Chair.
Congressman Dominan.
Thank you, Mr. Chair. At the outset, Mr. Chair, I wish to make it clear that I fully support the bills being discussed right now. Immunization is indeed very important, not just from the perspective of the beneficiary, but also from a broader public health standpoint. But just want to raise some questions to the DOH as regards the current status of our vaccination immunization efforts and perhaps how to improve on them. So currently po, what is the immunization rate of the DOH when compared to our national targets? Umabot po ba tayo sa ilang percentage on a nationwide level?
Sorry.
Yeah.
Mr. Chair, sana po yung actual POP at saka yung projected.
Yeah.
Yun yung sinasabi nila kanina. Kasi yung actual POP, mataas tayo. Kasi andun yung mga bata eh. Yung POP, ano to?
Yung recorded.
Projected.
Yung data
Yung projected, yeah. Yun yung talagang napakababa natin. Sige po. Thank you, Mr. Chair.
Thank you po, Mr. Chair, for the floor. I am Carmina Vera po. I'm currently the Immunization Program Manager of the Department of Health. So thank you for honorable for your questions. I would just like to answer them sequentially. The first one po, based on our latest 2025 annual data reported from our official reporting system from the Department of Health, which is the Field Health Services Information System, we currently have a fully immunized child of 64.27%. So this represents roughly 1.5 million children which have completed the required schedule FIC doses, and in comparison po to the national target of 95%, this is notably well below it. The projections that we use po are again based on the Philippine Statistics Authority. Although we are currently conducting ongoing coordination efforts with them. If we could determine a denominator that is still responsive po to what the LGUs, local government units, have been reporting to us and what the PSA has been projecting and sharing to the department. So currently, we still use a denominator of roughly 2.3 million doses, 2,392,000 under population of 0 to 12 months old po, for your information.
So thank you, Mr. Chair. Follow-up question lang, so I can get to my point. So more or less, depending on the base number, it's at 64%. So mababa po talaga. May I ask the DOH, Mr. Chair, how are they cascading the vaccination efforts? Sino po yung tinatap nila currently?
Thank you po for your question. So, given the current accomplishment po, we are cognizant that there needs to be a more significant catch-up effort, meaning we need to further intensify the routine immunization efforts. That's why we have also established various partnerships with not only the national counterparts, but we are also capacitating regional health offices to strengthen their partnerships within their jurisdictions, just to ensure po that most medical societies and other national government agencies po, especially our partners from the DILG, can also be hands-on po in improving the current immunization coverage rates that we are reporting.
So nabanggit po ng DOH, Mr. Chair, yung regional health regional partners and the DILG. But do I understand it correctly that we are not yet tapping yung ECCD Council? Early Childhood Care and Development, which the said council is also tasked with making sure that our children are of the proper health, which I would believe kasama doon yung immunization.
Siguro, Kong, Mr. Chair, siguro yung point ni Kong is, kasi, Mr. Chair, sana i-explain mo na lang sa amin. Yung FIC kasi, sasabihin mo po na it's a fully immunized children. Yun na yung 0 to 12 years old na na-immunize. Kasi may mga iba kasi na andun pa lang sila sa 0 age to kasi may mga vaccines pa sila na mailalagay.
Yeah.
Tinulungan pa lang po kita.
Yeah.
Sige, tuloy mo.
Pero if I may just respond to that, Mr. Chair, tama yung sa target natin na kinakount natin sa FIC is yung 0 to 12. Whereas yung under naman sa coverage ng 0 to 12 months. Whereas yung coverage naman ng ECCD Council, it's broader. It's 0 to 8 years, if I believe. 0 to 5, yun yung coverage ng ECCD Council, 5 onward sa DepEd naman. So, kasama sa coverage ng ECCD Council, yung mga bata na gusto natin ipa-vaccinate. No? And I ask this question, Mr. Chair, I want to make the point na there's already this framework, no, on how to cascade what is best for our children, including their health concerns, such as the ECCD, which member po ng council yung Department of Health. And how the council is set up, no? Nandun yung DepEd, nandun yung DILG bilang bastonero, no? Para mas mapilitan yung mga LGUs down to the barangay level, magamit yung mga child daycare workers nila, magamit yung mga barangay health workers nila, no? Ma-coerce and ma-implement talaga kung ano yung mga priorities na na-identify and na-set ng council. So, I think, Mr. Chair, no, if the DOH, or maybe I can propose this as an amendment, no, masama na lang sa bill na din-discuss ngayon, no, if the DOH can just bring it up with the council na, isama nyo sa ECCD efforts nyo yung pag-increase nyo ng awareness sa mga bata na kailangan sila ma-vaccinate, no? Kasi same yung coverage, 0 to 12 months yung gusto natin ma-vaccinate, yung ECCD council, 0 to 5 kasama sa kanila eh. No? So, kung madagdag na lang natin doon sa ECCD efforts nila yung vaccination, yung immunization, baka po mas mapataas pa natin yung current rate natin of 64%, Mr. Chair.
Thank you, Congressman Waminal. Maybe that would be included in if we have the final bills to be passed. I was
Mr. Chair.
hearing
Mr. Chair,
okay.
parang ang ano yata, ang DOH, ang talagang target nyo is 0 to 12, di ba? 0 to 12 talaga sila on the months. Parang iba, parang ngayon pa lang na 0 to 12 months ang kanilang target, nagdi-deplete na tayo ng vaccines. Yung OPV, MMR, yung mga PCV, wala na tayo. Talagang mas malaki pag idadagdag yung 2 to 5 years old, Mr. Chair, siguro talagang lalaki yung pondo para sa vaccination natin. Mr. Chair.
Thank you, Madam. I'd like to ask if for to the DOH that do you have plans to increase our target or our accomplishment with regards to the fully immunization?
Mr. Chair, if I may refer you to the program, because all of these are already in the program of the Department of Health. But just the same, we welcome the idea of Kong with regards to the inclusion of the early yes. So I will discuss this because I'm in the EXICOM level. I may be able to discuss this and see how we can go about it with the EXICOM, Mr. Chair.
Mr. Chair, if I may just clarify my suggestion earlier, I'm not suggesting that i-increase nyo yung target nyo to 0 to 5. No, I'm just saying na you make use of the ECCD Council. And in fact, yung ECCD Council, no, paiba-iba naman yung ginagawa nila for the varying age groups. No, I think kasama sa, yes, while they cover 0 to 5, no, depending sa age group, iba yung information dissemination nila, no? Pag example, nasa first 1,000 days ka pa, no? Yung information na ini-increase nila yung awareness is more on the breastfeeding and other concerns, no? Pero pag nasa 3 to 5 years ka na, no, hindi na lang sinasama yon. No, kumbaga medyo tailor-fitted naman po yung activities ng council depending on what the particular age group, age demographic requires. No? But since yung ECCD, sakop nila 0 to 5, and sa 0 to 5, kasama yung 0 to 12 months, no, baka for the particular 0 to 12 month demographic, no, maging mas active yung ECCD Council upon the prodding of the DOH, or if masama po, if the proposed amendment is acceptable to the authors, no, masama nila na yung 0 to 12 months na mga bata, no, mas tutukan nila, mas bibigyan nila ng diin when it comes to yung immunization efforts po ng DOH. Yun naman po yung ano ko, Mr. Chair, hindi ko naman po sinasabi na yung 0 to 5, i-vaccinate na lahat. But kumbaga, magamit lang yung framework, the system that is already in place, no, to improve our vaccination efforts na currently mababa po talaga at 64%, Mr. Chair.
Thank you, Congressman Minal. I think sa aking paniwala lang, we have to tap the local government unit, pati na yung RHU, BHW, kasi sila talaga yung nag-i-implement. So, counting push lang talaga. Oh, if you can devise plans to reward those who have yung nag-perform ng maganda, then you do it. Ang importante lang tutukan talaga. Kasi minsan, nakakalimutan kung routine na lang ang programa. Parang wala na lang. So, kanina I was hearing yung i-require yung pagpasok sa school, kung meron ba silang, tama ba yung narinig ko, na complete immunization ba to? Or may kompleto ba to o wala? So, ang tanong ko dito, paano natin i-implement yung ganon sistema? Tama ba yung narinig ko? Na i-require natin sa mga papasok sa school na meron silang complete immunization. In case, for example, wala silang immunization, can we go back to immunize them before they can go to school? Meron, yun ang tanong ko. Can somebody answer?
Thank you po, Mr. Chair, for your question. So the DOH po, we also conduct catch-up activities naman, not sa campaign, but rather catch-up immunization to cover those who were missed within the 0 to 12 months. So we do catch-up until po on the 23rd month, just to ensure that they are able to secure the complete list of antigens required by the national schedule. And also for schools po, Mr. Chair, we have a school-based immunization program din for grade 1 pupils, wherein we also administer antigens which have a rather higher incidence, particularly yung may MR and TD, and also for other select grade levels like grade 4 and grade 7. We administer vaccines to this age cohorts, grade cohorts po.
Thank you, ma'am. At least we are assured that we have that kind of program in the school, no? Sa DepEd, no? Tutukan lang natin mabuti to para we can prevent diseases coming in our schools. So I'd like to recognize also the presence of our Congressman Elijah Rombada, San Fernando. So thank you, Kong, for coming. So meron pa bang question?
Mr. Chair,